Good afternoon, everyone. Revising on the discussions that we had yesterday, we saw some interesting points that came out. We saw that we have evidence available with us for air pollution, which is impacting our health both in the short term and the long term. Yesterday in the opening note, Sri Suresh Prabhu mentioned that solutions are available, change is possible, but only with dedicated and concerted efforts we can achieve clean air. We also saw that Dr. Grigor from IASA highlighted that globally, people living in the areas with PM 2.5 levels within the WHO limit by 2040, this could increase from 61% to 96% if only multi-sectoral solutions are implemented. Our current air pollution policies are not sufficient and they won't be helpful in reducing the concentration levels until and unless we include the climate goals to reduce the health impact of air pollution. Ms. Priya Shankar from Bloomberg also highlighted that the key is to flip the narrative and see both air pollution and development as integrated goal. As we reflect on the ongoing pandemic, we have lost large number of lives to COVID-19 across the globe. We need to understand what the latest science shows us about the disease. Research has highlighted that people living in areas with unhealthy levels and exposed to fine particle matter are facing multiple challenges to their lung health. Across India, people are exposed to high levels of air pollution, and this leads to significant health and economic impacts. Yesterday, Professor Vivekanand Jha from the Georgia Institute of Global Health also stressed that people will go back to their normal ways if not presented with alternatives. Behavior change is hard, and relying on individuals' behavior change is not going to do much. These linkages between air pollution and severe illness highlights that critical need to ensure healthy air for all. Dr. Daniel S. Greenbaum, President, Health Effects Institute, also emphasized that if government needs to control emission, they should be acting upon source, not on ways by which these emissions can be captured. The key right now is emission reduction at source. Our Day 2 theme at ICAS focuses on specific interventions. These inputs from the global experts will definitely help us going forward in building the dialogue. Mr. Vikram Gulati, the country head and senior vice president, Toyota Business, also talked about energy efficiency, not because of their concern for the environment, but also because it makes tremendous business sense. With these highlights and key takeaways from yesterday's discussion, allow me to introduce you to our Day 2 theme of ICAS, that is priority areas of interventions. The understanding and assessment of air pollution in priority areas such as indoor, industrial clusters, slum, and agricultural farms to further understand air pollution inequality and its impact on vulnerable communities is crucial. And this understanding will definitely help us to improve the quality of life of our cities and states. With further ado, I now invite Shri Brijesh Kumar, IFS Principal Secretary, Ecology and Environment, Department of Forest Ecology and Environment, and also the Chairman of Karnataka State Pollution Control Board, to present the keynote of ICAS Day 2. Shri Brijesh, sir, over to you.
Thank you, Pratima. First and foremost, I should thank India Clean Air Summit, an annual flagship event of CSTEP, for having invited me to share a few words with you and all the participants. National Clean Air Program of Government of India is one of the very ambitious programs launched by Government of India in recent years. And the reasons are very simple. when we find that 20 out of most polluted 30 cities in the world are in India, it's a wake-up call for us. We are placing the health and the socio-economic aspects of our entire population to the hazards of unclean air, which includes air pollution as we conventionally know it. In India, we add noise pollution also as a type of air pollution as well. We understand the reasons, we understand how we have landed in this situation now. In past 1.5 centuries, all anthropogenic activities, including primarily fossil fuel generation and a number of other human activity, has led us to this position now. We in government believe that this is the time we must wake up, if not already late. Bad air and quality thereof is playing havoc on the health of our citizens, and also it is taking its toll on their economic activity as well. India, I'm specifically speaking of India, I must emphasize that we have a very different kind of geographical position. It's a monsoon climate where nearly all the precipitation is to be received by the land is received only in 3 or 4 months, which means for 2/3 of the year, the country is largely dry. That adds to a different kind of problem that we face. Largely the particulate matter due to human activity, transportation, fossil fuel burning keeps getting suspended for longer period than many other countries of the world. And this is one of the reasons why the solutions that we have to look for to address these issues should be different. We cannot simply copy or adopt the solutions which are being adopted elsewhere. I understand that this is easier said than done. One very important way to achieve this could be a cleaner fuel. This is a very tall expectation. When we have 15 to 18% of the world's population depending on a variety of fuel, starting from fuel wood to kerosene, it becomes very difficult to assure that all our population shall start using clean fuel. But the efforts are being made now, especially natural gas is one of the most promising entrant that we are handling now, and we hope that especially with natural gas and to some extent liquefied petroleum gas, we will be providing our people with relatively clean fuel that is expected to join our hands and help us to fight air pollution issues. India is a very large country. The problem of air pollution that is pervading in Bangalore cannot be compared to that of Delhi. And Delhi, naturally, we have to find specific solutions for each location. We do not have a uniform. It's not a small country. We have very large population and very diverse kind of habits as well. It becomes very easy to find a solution and replicate it. But in India, probably we will have to find a solution for each agroclimatic zone or each geographical zone specifically. Speaking for Karnataka specifically, we have clean air program in 4 cities. We are at a stage of conducting source apportionment studies. This is going to help us to address the problem of air pollution at the source level, which probably is what our scientists and technicians are pointing it to. General awareness is also one of the very important component of clean air program that we are exercising in the state of Karnataka of India. And we are actually collaborating with a number of institutions of repute to help us, because it is easy for us to implement when we have very sound technical backing, technical team with us, backend team with us. Noise is a very new entrant to the list of air pollutants that humanity is facing. Largely in urban areas, especially in the very densely populated pockets, we realize that noise pollution is also reaching dangerous levels. We have paid our attention to that issue as well. Regarding indoor pollution, probably in last 20 months or so, with the pandemic raging, becoming very serious in this part of the world, we realize that the indoor pollution also is very important, and more so because women and children are especially exposed to it. Work environment, also indoor pollution work environment, as well as in other occupational situations, it becomes very important for us to monitor. And today's session especially is very well poised, because unless we know we have a reliable data from the field, from diverse situations, we have lesser pointers to act on. As I understand, the technology is still evolving as of now, and we hope that cheaper and more reliable sensors shall be available at a sooner point of time. As an expectation, I would also, it will not be unfair on my part to expect that if these sensors become so cheap that they should be available at the cost of cell phones or maybe less than that, so that people in general, those who are not specifically assigned this job, can also keep monitoring and keep contributing to the data that we can have, so that we can act appropriately. With these few words, I thank CSTEP for having invited me. I hope that the session is going to be very fruitful. We also hope that the output from these sessions is going to help us in tackling the issue, which is to be handled by you and us jointly and successfully. Thank you very much.
Thank you so much, sir, for those insights and meaningful points that you highlighted. And definitely, as you mentioned, that we need to have tailor-made solutions for various geographical locations in the country. We just cannot blindly adopt solutions for other cities or other states. And as you mentioned, that technology is definitely evolving, and we will have to have pilot studies to understand these technologies, their efficiency level in helping to reduce emissions. So that is definitely crucial. But one important point is that we also need to look at women and children health. We need to focus on the inequality caused by air pollution. We need to also look at the work environment that we are working to understand how these pollution is impacting our health. And to do so, we all believe that awareness and capacity building is one of the key initiatives that will help us achieve the NCAP targets. Also highlighting that today at the end of the day, we are having an expert class on how to use low-cost census monitors. So the vision that you have given that in future, everybody can use a low-cost sensor and monitor what is the level of pollution around them. So with that vision, we are having this expert class, and we hope to build capacity, make everyone understand how these instruments work and what are the challenges of using such instruments so that we capture the reliable data and understand the hotspots in our cities and states. With those words, thank you so much for taking time from your busy schedule and come and give those insights to us. We definitely look forward to your guidance in future as well, sir. Thank you again.
Thank you very much. Thank you. I wish all good luck for this workshop.
Thank you so much, sir. Thank you. With this, I again welcome all the attendees with us. Some housekeeping points. We will keep participants in mute mode. They are requested to use the question chat window in the panel to post the questions, and request you all to please specify the speaker name to who you want to ask the question. After every session, we will have 10 minutes Q&A. In case we overshoot the time, we will collate all these questions and reach out to the speakers to get their responses. The sessions are recorded and we will share the link in case anyone misses out. If you are posting any quotes or any highlights from the session on the social media, we request you to please use hashtags like hashtag ICAS 2021, hashtag clean air for healthy living, hashtag women in AQ, hashtag CSTEP_India. Moreover, we would also request everyone to please modify your name using edit tab under the file and include your full name and your organization name in bracket. So with this, now I move on to our first session on day 1, which is measuring indoor air pollution and exposure impacts. To achieve better ambient air quality and improve the citizens' health, we need to understand air pollution exposure levels in enclosed spaces too, to quantify impacts and design epidemiological studies for assessing health risk. With this, I would invite our session chair, Dr. Bhargav Krishnan, adjunct faculty of PHFI. He has been a member of Government of India expert committees on air pollution and biomedical waste and has led work with central and state governments on air pollution, climate change, and health systems. He's also the co-founder of Care for Air, a not-for-profit working on air pollution awareness programs and school children in Delhi. Over to you, Bhargav. Welcome.
Thank you so much, Fatima. Hope you can hear me clearly.
All clear.
Great, thank you. It's a pleasure to be moderating this session today. And after the excellent background given by the previous speaker, Mr. Kumar, I think it's great to have this session on the impact of indoor air pollution exposures in India. The previous day, we had different conversations around ambient air pollution, its linkage with SDGs, but the sort of continuing thread across the last several decades around air pollution in India and the extent of exposure work that has been done over the last 3 decades has primarily been around household exposure to cook stove smoke. Over the last couple of decades, we've seen significant improvements in reducing exposures to household air pollution. However, even new programs like the Ujjwala Yojana, for instance, while improving access, have left us wondering how to improve sustained use of sustained and exclusive use of clean cooking fuels. a lot of this work would span different areas of expertise, whether it be exposure assessment, public health impact assessment, as well as sociology and behavioral sciences. To discuss some of these aspects, we have an excellent panel here with us today of experts from around the world. We will first go to Dr. Kalpana Balakrishnan, if that's okay, and I can see that she is online. Dr. Balakrishnan is the director of the WHO Collaborating Center at the Sri Ramchandra Institute of Higher Education and Research, and has really laid the groundwork for the last several decades of high quality work on household air pollution exposure assessment health impacts in India. Dr. Balakrishnan was also a member of the steering committee on air pollution of the Ministry of Health and has led several task forces on assessment of impact of air pollution and health. So, Dr. Balakrishnan, I'll hand over to you at this point.
Hi, good afternoon. Pratima, will you be sharing the slides?
Yes, we will share the slides, and we will also give you the keyboard access in case you want to change slides from your end, or else we can do it from here as well.
Good afternoon. It's a great pleasure and privilege to join this session. Good afternoon, Dr. Balakrishnan. It's a great pleasure to welcome you in your new capacity after having finished your doctoral degree recently at Harvard. I've known and worked with Bhargav. I had the privilege of doing so over the last many years, as with the other panelists, Dr. Bhushan and Dr. Pallavi. And thank you, Pratima, for putting together all of us who have had the privilege of working together, deliberating on these issues. And it was really nice to start the session with some words with the keynote speaker today. I titled this as Indoor Air Pollution and Exposure Impacts, and keeping in line with what the organizers have put in. But I think, for the reasons of standing corrected on how this risk factor is framed by the WHO and the burden of disease exercise, we would want to label this primarily. Of course, I recognize that you're talking about indoor air pollution beyond household air pollution. Totally, but my particular session would be focused on household air pollution and the need for sound epidemiological studies to improve health. And therefore, by definition of the source being indoors, but the emissions being seamlessly spread across the indoor and the outdoor environment, the implications are not just for indoor air pollution. The implications are for the source that is primarily located in the rural indoor environment. And therefore, wherever we talk about air pollution associated with emissions from household fuels, we would need to qualify that it is beyond the indoor boundary. And in fact, it is now recognized that emissions from household fuels is a major contributor to ambient air pollution. So I think in the first panel, what I wanted to sort of look at saying is that and the reverse is true for the ambient sources too. So the sources may be, the sources of indoor air pollution may actually be ambient sources. And therefore, in India, we are, constantly faced with the situation wherein household and ambient air pollution, indoor and outdoor air pollution coexist, and therefore it is it doesn't take very much insights from anyone in the field to sort of recognize that we can't compartmentalize this across rural or urban boundaries or indoor and outdoor boundaries, especially when it relates to health concerns. So what we need is that we have learned quite a bit about the health impacts from household exposures and many of the other exposures that are cited here, and whenever we are asked to talk about epi studies, this is the first thing that policymakers often ask us: do we have enough local epi studies for us to be able to really understand the health impacts? And so therefore, one of the distinctions I want to sort of clearly make here is at the end of the session, the biggest takeaway would be we certainly don't need any more epi studies to sort of initiate action, but we certainly need epi studies. I think our keynote speaker also mentioned, to nuance it locally, sort of really understand what the relative attributions of exposure and health impacts are to these various sources that are causing indoor air pollution. You might have an indoor air pollution situation in which the occupational attributions are overwhelming and they are far greater than household air pollution. So therefore, everywhere that we are talking about, we need to sort of look at where the exposure and the health attributions from these various sources are. And that's where nuanced epi studies can really provide you the insight. So sound or well-designed epidemiological studies can really provide valuable information on differential exposure and health impact attributions for household versus ambient sources within populations at the local, state, regional and national levels. So, but bulk of the information that is available to us in terms of health impacts, health burdens attributable to household sources have primarily been at a macro level, and that's what has been the primary piece of information that policymakers have actually are receiving. So if I can have the next slide, let me share briefly what we have learned from the India State Level Burden of Disease Initiative that primarily uses global burden of disease methodologies, and then get on to what we have and are continuing to learn from epi studies conducted in India. And over the last many years, the evidence for health damaging exposures has been unequivocal. And in 2019 and in the many previous years of assessments, annual population weighted mean exposure to ambient PM 2.5 was estimated to range anywhere between 70 to 90 micrograms, and doesn't require rocket science to figure out that nearly 90% or 95% of our population continues to be exposed in excess of the Indian national standard and very much significantly in excess of the WHO air quality guidelines. The proportion of the population relying on solid fuels is decreasing, as is being reported every year, but it continues to be high. So even if you are looking at a current number of 50 to 55% of population relying on household fuels, that is still about 700 million people receiving it in the indoor microenvironment while they are cooking. And because of the virtue of these emissions being released to the outdoor ambient environment, there is an equal number of people within these communities who are probably using clean fuels inside their homes but are actually exposed to emissions from household fuels that is being released into their ambient environment. And so and now we recognize that through an increasing pool of studies that household emissions contribute anywhere between 30 to 50% of the ambient air concentrations on the average in India. And so if you can look at this not just being an indoor air pollution problem, this would really bring a lot of weight to air quality actions, because regulation is primarily focused on regulating the ambient air more than the household air or the indoor air. And if you're looking at a source that is a primary contributor that can give you co-benefits for both the indoor and the outdoor air, it really changes the conversation. If I can have the next slide. So because of this dual contributions to both indoor and outdoor exposures from household air pollution, naturally the health burden from exposure to air pollution is extremely large. Overall, some 1.67 million deaths attributable to air pollution, and you will recognize that the ambient air pollution contribution is now exceeding the household air pollution contribution, which it used to be the reverse case a decade ago. But this has happened mainly because of not only advances in exposure assessment methodologies, we are able to better account for the contribution of household sources to ambient versus indoor exposures. In addition to the decreasing trend of solid fuel use, the worsening air quality in cities, both of which are responsible for this burden shifting more towards ambient air pollution concerns as opposed to household, there is also increased understanding that household emissions are a major player for the ambient part of the contribution to the burden as opposed to the household part of the contribution to the burden. Can I have the next slide, please? This is as far as this is the piece of information that all policymakers all the time see. 1.67 million deaths attributable to air pollution compared to a much smaller number from some of the traditional risk factors that we have grappled for a long time. Smoking, cholesterol, lifestyle, behaviors. It doesn't, strike us as something that is so overwhelming that it should merit so much attention. We've been able to act on smoking. We've been able to act on salt. We've been able to act on sedentary lifestyles, but we really haven't been able to sort of act on this with the same amount, and this is partly because as you can see, what constitutes an adverse effect of health effect of air pollution is a complex battery of disease or health endpoints, and pretty much every organ system and throughout the life course you have some amount of insults happening to the body on account of air pollution, and therefore to sort of tease this out in a way that the relative risk of air pollution exposures for each one of these endpoints is unequivocally greater than any of the other risk factors has been a very challenging task. So the relative risks associated with air pollution exposures have been relatively, comparatively small when you look at risks from smoking, for example, where the relative risks are very high, but the exposures fortunately have come down to smoking, come down because of the intervention efforts that we have been able to take on smoking. On the other hand, in air pollution, the relative risks are small, mainly because people are exposed. We have not been able to sort of really document the association to be stronger than that, because it happens over a very, very long period of time and over multiple mediation pathways. Therefore, to sort of tease it out for any one health point is quite a difficult task from an epidemiological point of view. But the point that I wanted to take away is, even if you looked at the burden of disease estimates and thought that it's a large number, as we get better with epi methods and really be able to sort of establish very high-end and high-resolution exposure measures and very nuanced prospective health measures, this burden is only going to be a larger number than what it is today. The burden of disease methodologies only captures a few of the health endpoints that we now know are well associated with air pollution, and normally it is thought that most of these health endpoints have been examined in the context of ambient air pollution. Whatever we are finding in the smoking literature has now been found in ambient air pollution, and whatever we are finding in the ambient air pollution literature is now being found in the household air pollution literature. So therefore there is really a seamless way that we have to start approaching this entire situation, and the complexity of the epidemiological studies is not trivial for us to be sort of able to fully capture what is the total burden that is that can be attributable to air pollution. Can I have the next slide? Much as policy-making community has been requesting for a greater representation of the India base of studies in the global pool of evidence, or for that matter, burden of disease calculation entirely informed by India-based epidemiological studies. The global burden of disease methodologies has been primarily focused on long-term mortality associated with cardiovascular disease endpoints. And since many of these studies are harder to mount and happen over a much longer time frame, the epidemiological studies conducted in India have not necessarily been exactly in line with what the global burden of disease methodology can readily adopt. Although there is an increasing pool of studies now that will allow their inclusion, but I wanted to share, what is the evidence and experience from epidemiological studies conducted in India. Like I mentioned, the burden estimate is enough for us to start acting. But what we want to look at is how can this evidence be included in programs for facilitating clean air actions as well as prioritizing clean air actions. What pieces can the epidemiological studies conducted in India provide so that these clean air actions can be facilitated? That you need clean air actions is a given. That point is already made by the burden of disease methodology calculations. Can I have the next slide? And I will share, perhaps 3 or 4 focal areas in which the collective pool of epidemiological studies in India have been able to make significant progress. Shown here is just a smattering of studies, primarily those that have been led by our group in collaboration with our partners. This is by no means a comprehensive list of all endpoints that have been examined in epidemiological studies conducted in India, but Bhargav and others would agree that now there are several prospective rural-urban cohorts that have been able to address health impacts of national relevance, and because of the fact that they have been prospective in nature, it has been possible to overcome the limitations of secondary health data that has often not been accessible. It has been possible to collect primary exposure data. It has been possible to collect primary health data, to be able to look at exposure response relationships for many nationally relevant health impacts: birth weight, child pneumonia, child growth and development, cardiovascular diseases, asthma, ARI, and respiratory morbidity, to just mention a few. Next slide, please. The other important, yeah, Bhargav?
Sorry, ma'am, just quick time check. If
a
we can
minute.
conclude with seconds, that would be good.
Yeah, all right. Yeah, so the other important headway that we have been able to make is in developing, validating, and deploying field instrumentation to capture exposure heterogeneity. I think the keynote speaker and several others mentioned the need to sort of really look at, higher resolution exposure information to be able to look at where these exposure reductions have been achieved and have not been achieved. So collectively, EPI studies conducted in India have been really able to develop, validate, and deploy field instrumentation to really parse out this exposure heterogeneity. Can I have the next one? And this, when combined with biomarkers, has really provided, a great deal of insights into sort of really strategizing as well as strengthening the evidence. If I can have the next slide. And finally, the EPI studies in India have not only stopped with being able to conduct observational studies and to sort of really look at the exposure response relationships, but they have been able to inform implementation science by piggybacking onto ongoing programs and participate in the evaluation of clean technologies. Let me just share 2 quick slides of an example study that is currently ongoing before I conclude. One such, next slide, please. The observational study conducted in Tamil Nadu some years back provided some of the first evidence to sort of look at anticipated health benefits of an LPG intervention. And if you can see the next slide, this observational study now has led to one of the first multi-country community-based randomized controlled trial of an LPG intervention to examine, next slide please, to examine the effect of an LPG intervention using an experimental study design on birth weight, child growth and development, and blood pressure. So if you recall the first slide that I had shared about observational studies that had been conducted previously, all the health outcomes of national relevance had already been studied, within the ambit of observational studies. Now we are able to sort of really examine the same health endpoints with slightly more rigorous epidemiological designs, something that was thought impossible some years ago in terms of actually being able to do an RCT in the community using interventions that can be taken at scale are currently underway in India, and we are now waiting to see what the results of the RCT are going to be. So I have the last slide, I think. We have to sort of really look at, interfacing these types of action for household air pollution along with other sectoral interventions. And I think I have 2 more slides. Can I have the next one, please? And not to forget that the other elephant in the room is, the multidimensional poverty. Whenever we talk about household air pollution, we are not going to be able to sort of really address the attribution of household air pollution for any of the health impacts if we are not really able to address some of the other competing risk factors in our population. And this is actually my last slide. It's kind of hard to keep tabs on it when you're not scrolling yourself. Next one. Okay, so all I want to say is, we really want EPI studies to inform us about evidence-based practice. I think we now need EPI studies to move on to practice-based evidence. The practice of clean air, the practice of clean air and cleaner actions has to, get launched and become the norm. And the evidence that we gather from alternative levels of practice has to be the new paradigm for EPI studies. Rather than using EPI studies to initiate action, can we look at EPI studies being mounted on actions that are already underway or being planned in such a way that we can have more practice-based evidence for augmenting clean air actions. Thank you.
Thank you, ma'am, for that tour de force, really, in such a short amount of time. And I think an important call to action on the need for quote-unquote practice-based evidence. I'd like to now invite our next speaker, Dr. Pallavi Pant, please. Yes, Dr. Pant is Senior Scientist and Lead of the Global Health Program at the Health Effects Institute in Boston. Dr. Pant has worked on characterization of urban air pollution in the past and has worked with a range of international and Indian nonprofits. Also runs the very popular Twitter handle Air Quality in India, which is widely followed and has some of the best information up to date on air pollution in India as well. She's also the social media editor for the Journal of Exposure Science and Environmental Epidemiology, and will speak to us on global experiences on measuring indoor air pollution. Over to you, Pallavi.
Thank you, Bhargav. It's a pleasure to be here and, actually follow Kalpana after such a wonderful overview of where we should be heading. Pratima, would you be sharing the slides or should I try doing it on my side?
Pallavi, yes, we will share. Just let me know if you're able to change the slides from your end. We have given you keyboard access.
Let me give that a try. Yes, perfect. I can. You see. Great. So over the next few minutes, I would just like to talk a little bit about the exposure piece within the broader framework that Kalpana described of conducting health studies. And she already, discussed this point in a lot of detail, but just if we start with this notion that exposure to air pollution across India is very high. We are continuing to get exposed to PM 2.5 levels, both inside our homes and outside, which are very high. Give me one moment. This is my wake-up call for my everyday. So sorry about that. But the exposure levels remain very high. And as we can see here, the two maps represent the exposure to ambient PM 2.5 and household air pollution. There are variability patterns across the country. There are places we see relatively high exposures compared to others. And these variabilities in exposures are carried through to even very small scale. So if we begin to go from the very big sort of national level picture across India to specifics of what you and I experience on a day-to-day basis. And when we think about exposure assessment, what we are primarily trying to do is characterize what levels of air pollution are people getting exposed to in different environments, whether they're indoors, outdoors, trying to go from one place to another, recognizing that these exposures are very dynamic. So when you undertake your day-to-day activities, that is going to lead to a different set of exposure patterns than when I'm leading my daily activities. And I want to use a couple of examples here to highlight what that really translates to. So if you look at the pictures on the other side, these are just snapshots of activities that we see around ourselves in India. So picture yourself as an Amazon delivery person or a Flipkart delivery person who is spending a significant portion of their day on the road trying to get from one part of the city to another. What they get exposed to and what their exposure profile is going to look like will be very different from what a woman in a rural part of the country, primarily spending her time sort of cooking with solid fuels, is going to look like. And when we start to think about how our health is getting impacted by air pollution exposures, it is important for us to think of what these personal activities mean for exposures and what the scale at which we're trying to estimate the exposure means. Are we looking at the individual personal exposure level, or are we talking about the population exposures? Because the methods we use and the ways in which we then apply these exposure data to health studies can vary quite a bit. And one thing I sort of want to clarify or sort of start by saying is that there are a number of different ways in which we talk about air pollution. So we talk about air pollution emissions, which is essentially what's coming out of a source. Think about how much fuel you're burning versus how much PM 2.5 that releases if you're driving your car. That's when we're talking about emissions. The other piece we talk about most often are air pollution concentrations. So essentially, what levels do I see or measure in any particular location? It can be outdoors, it can be indoors. And then as a next step, we look at exposures, which take into account the concentrations, but then also add in the piece about where and how and for how long are we getting in contact with a particular air pollutant. So essentially, then our personal exposure to air pollution is the level of the air pollutants. It can be PM 2.5, it can be carbon monoxide, it can be PM10 or other pollutants, as well as the time we're spending in contact with these pollutants. And that is going to vary significantly depending on what a person's daily schedule looks like. Now, for some studies which are at a much bigger scale, so the national level studies, the global level studies, often cannot really take into account every single individual's exposure. It's hard to measure, financially impossible, and we don't have the time and the resources to do it. So in those cases, we use the information we get from these personal exposure estimates and from ambient monitoring data and other types of information to estimate what populations across a city or a state or a country or a region are getting exposed to, and then apply them to specific health studies to understand what the impact is. And again, here, we are constantly thinking about people's exposure patterns and trying to determine what their behaviors are, where they're spending their time, how much they spend indoors versus outdoors. I think in the last year especially, we've also as we have spent most of our time indoors, we've started thinking about what the indoor air quality in urban environments can look like. And I think Kalpana made a really key point where there's two ways we can think about it. So there's, household air pollution that has its related health effects, but then even in urban homes where we may not be using wood or animal dung for cooking, we are getting exposed to other types of pollutants, especially in Indian homes where our windows, tend to allow a lot of leakage from outside air pollution. So even in a place where you're using clean fuels, and perhaps trying and thinking that we've got that covered, we have various ways in which outdoor air pollution and indoor activities can influence our exposures. So the major measurement approaches that we can use, again, depending on whether we are trying to measure a person's individual exposure or trying to estimate the overall population exposures, are as follows. We can, look at the ambient air quality monitoring data. In India, this network is now expanding very rapidly. We are setting up monitoring stations which are continuous, provide data on a number of different pollutants in different parts of the country, including urban and rural areas, which is a good development. We can also use personal or microenvironment monitoring. So what I mean by this is, I could put a sampler on an individual and let them go about their day and then see which activity corresponded with what kinds of exposure levels. Or I could place air quality monitors inside their home and in their kitchen and in their workspace to see how long they spend in their kitchen versus their office versus their home, and what were the levels that they got exposed to in those places. However, this is not something we can do at a very large scale. Therefore, we use a variety of modeling approaches, including satellite-based estimates, which are now becoming available, as well as land use regression models and other types of modeling methods to estimate exposures for populations. And I want to give maybe a couple of very quick examples. So when we think about measurement of personal exposure, what are we looking at? We often get these types of figures that you see here. They're taken from two different studies, but essentially presenting a similar picture of, what were the levels of exposure to PM 2.5 levels when the person that was undergoing the monitoring at the time was in different environments. And so we see peaks. This is when people are doing activities that might correspond with higher levels of air pollution exposure, such as commuting, cooking, cleaning, and also, how that varies when they go from an indoor environment to an outdoor environment. But as I said earlier, these studies require very intensive efforts. We require monitors, we require people, and we also need individuals willing to take on these, equipment, live with them for several days. So they are often used in cases where we have a smaller group of people that we can monitor. And both Kalpana and Bhargav have actually sort of done health studies that have used these types of approaches. But in other cases, when we start to zoom out a little bit and look at populations at a larger scale, so not really going to one individual versus the other, but a whole population, we start to look at broader approaches, including modeling methods. One way that people have been using data combining ground-based monitoring, so our air quality monitoring network, satellite-derived estimates, is preparing these types of exposure maps that you see here, which essentially shows you what's happening across the country. And you can take that information, use the exposure response functions to get to the kinds of estimates that Kalpana mentioned, looking at the country level, looking at the state level, what kind of health impacts do we see? Another interesting approach that is now being used in India and has been applied to a couple of different studies is trying to bring in all of this information that I just mentioned, so ground monitoring data. You bring in the satellite-derived estimates, but then you also start adding other variables, including land use and what the specific patterns are in a particular city to prepare exposure estimates, which can then be applied to a particular location, to multiple locations. So there are different ways in which we are doing this, and the last few years have been very exciting because we are starting to see a lot more data, just as Kalpana said. But that brings us to the next point, which is we have a number of things going on across the country. How do we continue to make progress? How do we know what we are getting exposed to? How do we use it for health studies? And ultimately, how do we use it for policy making? And I think one way in which we can think about doing this is by creating more informed linkages between the health studies that are underway and the assessment of exposure that's being undertaken perhaps by a lot of different groups across the country in different ways, using different methods, as we just discussed, and also strategically pairing areas where we are setting up new monitoring data with trying to conduct health studies in places where we're beginning to get this good information. For a long time now, we have also been collecting filters from different sampling stations across the country, using that to understand what the patterns for air toxics are. So going one step beyond PM 2.5 to look at other sort of individual pollutants. And then finally, trying to also expand our capacity to utilize these methods in different institutions and creating ways in which new types of sensors, which are easier to carry, cheaper, as our keynote speaker said, and more ubiquitous, can be facilitated in an easier way. And then ultimately utilizing the information that these exposure assessment studies and health studies are providing to inform where we take our interventions, and including public health and people's well-being into account to design policies that will lead us towards cleaner air and better health for all. So I will stop there and hand it back to Bhargav.
Thank you so much, Pallavi. I think some interesting points made there on the use of various different exposure assessment methods and the need for sort of high spatial and temporal resolution data as well to understand exposure profiles in greater detail than we had before. I'll quickly move on to our next speaker in the interest of time. Our next speaker is Mr. Bhushan Thulazar from FHI 360. Sorry, just hold on one second. Yes. Mr. Bhushan has previously served as a Chief Technical Advisor in South Asia for UN Habitat's Urban Basic Services Branch and Head of the Environment Department of Kathmandu Metropolitan City. Mr. Thulazar will be speaking to us today on the experience of exposure assessment for indoor air pollution in Nepal. So I'll hand it over to you, sir. I'll give you a 2-minute time check when you reach there.
Thank you. That's very helpful. I'll just get started immediately. Let's see. Can I use my own?
Yes, Dr. Bhushan, we have given you the keyboard access.
All right. Oh, there we go. Sorry. Okay. From India, let's go on to Nepal. But I think both Pallavi and Kalpana showed that one map of India where the darker shades were in North India, UP and Bihar. Now, just north of that, of course, is Nepal. And Nepal, of course, a lot of people see Nepal as a very mountainous country, which it is. But 50% of the population actually lives in that small strip of land just north of UP Bihar, which is actually an extension of the Gangetic Plains. So that color could probably be shifted a little bit higher, and you'll see the exposure faced by a lot of Nepalese. And plus, the other issue is that even in the mountains, a lot of times the exposure is very high because people use open fires for space heating, and particularly in rooms with very low ventilation and so on. So it's a key issue in the mountain region as well. So this issue is a very important issue for Nepal, and that's what I'm going to talk about. But before that, FHI 360, we work primarily on public health and well-being, and as we saw earlier, this is an issue that's related to public health and well-being. So we're very much interested in working in this issue and expanding our work in this issue in the future. And we know that Asia Pacific region is a key area that where we need to intervene there. Now, let me take you to the village of Gatlang, which is a small village in the mountains of Nepal, in Rasua district. You can see it's small houses all packed together. This picture I had taken around noon, so it wasn't really cooking time, but still 2 houses there, you can see some smoke coming out. When it's really cooking time, which is 9 o'clock, 10 o'clock, you'll see all the houses smoke coming out. There are 1 or 2 houses with chimneys, but otherwise it's just houses with very poor ventilation. That's the environment we're talking about. In one of these houses lives Sasingdoma. Sasingdoma, with her little child, spends a lot of time in this kitchen. We know that just by looking at it, she and her little child is exposed to very high level of pollution. And we already heard about what that will have in terms of impact on pollution, deforestation, climate change. We talked a little bit about that yesterday. Health impacts, Kalpana has talked a lot about that. I don't need to go into that. Pretty much every organ in our body, every system in our body is impacted by air quality. But it goes beyond that. It goes to impact on education. Children spend a lot of time collecting firewoods. When their health is affected, they can't attend school regularly. It affects women's issues, women empowerment, because of the drudgery, the lost time, injury. You can see the pot over there is black. Try scrubbing that pot. It takes a lot of time and effort. So it impacts women, and overall, Kalpana also mentioned it earlier, it impacts poverty, income. When the cost of fuel, cost of health impacts, and loss of productivity all adds up. Now, this is from studies that Pallavi's institution was involved in, State of Global Air. I'm sure a lot of you have seen it. Nepal, if you look at that's the graphs from South Asia, we're right up there where 2/3 of the houses still depend on solid biomass fuels for cooking. That results in very high levels of pollution and, of course, health impacts. The graph at the right is the number of deaths attributed to household air pollution. In Nepal, that is around 21,000, over 21,000, but it's less than India, of course. But then if you look at per capita basis, it's more. So it's a big concern for us. Now, this is a study that we were involved in, that I was involved in when I was with a previous organization. It's about 13 years ago we did this. And Kalpana had mentioned in her last slide, if we want more evidence-based practice, we need more practice-based evidence. And I think this is something that we try to do then. And I just want to follow up with that last slide and see if that can be applied here. Now, the government had been promoting the simple mud brick type improved cook stoves for a long time. By 2007, about 200,000 households had these stoves. And we wanted to look at what exactly is its impact on it, performance in terms of, is it reducing air pollution? If so, by how much? What is the health impact? So what we did was we designed a longitudinal study. We looked at the before and after putting stoves. So we looked at people who had showed interest in putting a stove, went to their houses, did this assessment, both in terms of indoor air pollution as well as health, which is basically in health. We didn't do a big epidemiological study. It was mostly just questionnaire-based perception of the main cook. And we're doing this in 3 locations all over Nepal, which was Dolakai, which is a district in the mountainous region, Ilam, which is a little bit more hill region, and Dang, which is in the plain regions, covered all of the ecological regions and throughout Nepal. And we were using, in fact, for the first time, we were using this UCB, the particle monitors developed by the University of California, Berkeley, clean air group there. And then the Hobo loggers to do CO monitoring, and we took 24-hour sampling. This was a study that was funded by the government itself. The government was interested in doing this, so it was, and AEPC is the Alternate Energy Promotion Center. They were very keen on seeing the performance of these stoves. So this is what we did. And then, as Pallavi mentioned earlier, to do actual exposure studies is very difficult when you have to combine the time of exposure versus the concentration and all that. So what we did is we just looked at the concentration of PM 2.5 and CO, but we try to keep that concentration very close to the where the main cook stays. So that's 1 meter from the kitchen and a height of breathing height, which is 1.3 meters. We use this, got the data, and then that was what the study was. As I said, it was before putting the stove, sorry. And just some key highlights of it. The level of indoor air pollution in houses with TCS, which is the traditional cook stove, is much higher than WHO guideline values. Obviously it is. But we were quite amazed by how high it was. After the installation of an improved cook stoves, yes, it went down significantly by around 63% or so on average. But it was still higher than the WHO guidelines. And that's why I think there's a push towards promoting better stoves, from tier 1 to tier 2, tier 3, tier 4 type stoves, now into electric cooking. Big way trying to promote that. But also the large difference in pollution levels in different houses both before and after the installation of ICS, shows that other factors besides stove design, such as ventilation, cooking habits, and so on. These are very important factors that need to be looked at while promoting the stoves. Now, this is just some of the figures. And again, these numbers, we don't have to go into detail, but the left number shows these very high levels of PM 2.5 in Doloka, as I said, is a mountainous area where a lot of times the cooking is done in closed environments where ventilation is very poor. So there you see that even with an improved cook stove, the average PM 2.5 level is higher than, for example, a district like Ilam, where with very good ventilation, even with their traditional stoves, they do better than the improved stoves. Okay, so ventilation again very important there. And then you see the distribution there. In some cases, the reduction in PM 2.5 is after 3 months is over 90%. In some cases, it's very low. In one household, actually, it went up, and that was because of another factor that was influencing there. Then if you look at after 1 year, what is good is even after a year of using the stove, there we could still see a lot of improvement. Like, as I said, around 63% in PM 2.5, 60% in CO, and even in some houses up to 90% reduction. We saw that. But as I said earlier, ventilation makes a big deal. The two houses that you see above is from the district called Ilam, is in eastern Nepal in the hills. The house design is such that there's usually a place for the smoke to escape from the roof on top, and also the kitchen had the big windows, as you can see over there. So that makes a big difference. How you use the stove makes a big difference. If you put in a lot of wood, and the fire, much of the fire is actually burning outside the stove, as you can see from that figure, that stove isn't working too well. How the chimney outlet is placed makes a big difference. In that picture, you see the smoke not going anywhere, a lot of the smoke coming back. And even within a year, we saw some houses with clogged chimney that needed serious cleaning up. So the soot was going into the chimney and clogging it up, and the smoke as a result was coming back into the kitchen. And then, of course, the health impacts. As I said, this was a very preliminary study, just based on the perception of the cook. And that is important for how people take up the stoves. Remember, this is a study that was not being done by a university or a health organization. It was done by a alternate energy promotion center, a center that trying to promote clean cooking. So they're looking at how people see their health before, 3 months after, and ICS after putting the improved cook stove. And clearly there is some improvement that people felt because of the improved cook stoves. So overall, what we see is that the IAP levels, as I said earlier, with the traditional cook stoves are very high, but with the improved cook stoves, it can come down significantly, more than 60%. Not good enough, but quite good. Okay, and other factors are also very important. And overall, the ICS users seem to be satisfied and with the stove, as well as they seem to experience some health benefits. So overall, we felt that, and we recommended that although the mud brick stoves cannot reduce the pollution levels to optimal levels or WHO levels, it's still very good. It's a cheap option that can be built locally, that's often built locally, promotes employment among the stove builders. A lot of them are women, so it should be promoted. But on the other factors, such as good ventilation, proper and O&M systems, and so on, also needs to be looked at, obviously, and other stoves also need to be promoted. So since then, what has happened is that the number of stoves has increased from, like I said, from 200,000 to, I think it's about 1.4, 1.5 million now. Some of it are working, some of it not working. What we saw was that, in Nepal, as you said earlier, a lot of studies have been done, starting from what Dr. Pandey, Meghandas Pandey was doing way back 40 years ago, looking at these studies, some epidemiological studies in Jumla region, to now where, like I said earlier, you're using more sensors to actually look at exposure times, as well as actual real-time data coming. For example, now electric stoves are being promoted, and the study that we see in one of the pictures over there, where it's actually an app being used for people to monitor the energy use as well as cost in real time, so that they can see whether there is a benefit of using an electric stove. Of course, other issues have also been monitored now. But what is important, I think, now is that you can't promote just one type of stove. Most of us have different types of stoves in our house, or cooking devices in our house. We might have a rice cooker, we might have an LPG stove, we might have an induction stove, and so on. and people use it as they see fit, as it's appropriate for them. So a combination of that and their impact is also very important, and that's what some of the studies that are going on right now are looking at. And with that, I'd just like to end by again summarizing that it's very important to look at these issues, just like Kalpana had said earlier as well, and link it with policy, and especially if the policymakers, development practitioners are doing them, that's important. Various cooking solutions are available and are being promoted by the government as well as market forces, so they need to be looked at. I mean, the picture of next shows how LPG is moving up the mountain slopes in Nepal. And there's an urgent need to strengthen supply chains and create demand for clean cooking options. And for that also, monitoring is important, as the late Professor Dr. Craig Smith always said, you get what you inspect, not what you expect. So inspection in that sense is very important. And in this process, we look forward to working with all of you in the future as well. Thank you very much.
Thank you so much, sir. And I think that's a remarkable picture, I think, of a person carrying LPG cylinders up a mountain slope. I mean, that's I don't think I've ever seen anything like that before. But the commitment to clean household fuels is really commendable. I'll move on quickly to the questions. I think having just seen through the sort of questions that have been posted here, I think I'll combine a couple of those and refer them to the panel. Essentially, the questions are looking at what methods we have currently available that allow us to distinguish between what sources of air pollution are household versus ambient, and how you would do that or how that kind of measurement is affected while conducting a study in a rural versus an urban environment. So perhaps Dr. Balakrishnan and Dr. Pant could answer those questions.
Both types, there are two primary approaches that we have used within an epidemiological context to look at, source attributions for exposures. One is, of course, there is an increasing realm of personal monitors that are being deployed. So you actually get both real-time as well as integrated data from these personal exposures. And when you integrate this with, the time activity profiles of the individual, you can get a qualitative sense of which sources are likely to have contributed to which which exposures. So that's one approach that people have used to sort of really look at what is the ambient exposures at times when the indoor sources are not present versus when the indoor sources are present, to sort of tease out the relative attributions of personal exposures to indoor versus outdoor sources. The second is, of course, we do have fairly good integration with source apportionment and other kinds of source signature studies, wherein we are able to sort of really attribute this to specific sources. So we know the source profile at fairly high resolution now, and therefore it is possible to sort of distinguish, out of the total PM contribution, what concentrations are attributable to what sources, and then you can go to the next step of sort of really looking at what exposures can be attributable to those specific microenvironments or those specific concentrations that are happening from sources. So using a combination of these two, we have been able to sort of really, again, as what Pallavi illustrated, this can't be done at scale. So this has been done at the micro scale, at multiple locations, rural and urban, at various types of land use pattern configuration. So this has provided the answer for us to be able to scale it at the state and national levels.
Thank you so much. And Pallavi, just to follow up on that, is this perhaps a more challenging exercise to conduct in a sort of peri-urban or urban environment where the diversity of sources may be may pose more of a problem when you're trying to tease out the contribution of household versus ambient sources?
Yeah, definitely. I think for groups that have been trying to do this type of assessment, especially figuring out which sources perhaps have a bigger contribution, it tends to be more challenging in urban environments just due to the diversity. But as Kalpana was saying, taking into account, methods like source apportionment, which have helped us understand the relative contribution, and also different sort of chemical transport models, which allow us to see how sources are generally contributing in a given location, has been very helpful. And we are continuing to, improve the modeling and ways in which we can do this assessment. The only thing I'll add to what Kalpana said is actually in the Indian situation, or in the Indian context, we have a very strong experience of understanding exposures in households, and a lot of that work has been led by Kalpana's group and others, and has actually informed what we know now globally in terms of household air pollution exposures and health effects. So we can take some of those learnings from how we sort of did them and apply them now in different situations to improve these estimates over time.
Thank you. I'm conscious of the time that we have left, and so before we wrap up, I think I'll pose a question to the entire panel, and we'll start with Mr. Bhushan Thulazar. So you've seen sort of significant efforts happening across South Asia over the last several years to transition away from wood and coal and other such polluting fuels towards cleaner fuels for cooking. What do you see as the sort of next frontier in this push for cleaner cooking in Nepal, and what do you think are the sort of key barriers? If you can give us a sort of 30-second outro on this, that would be great.
Thank you. Two things. First of all, yes, there's been a lot of effort, but definitely not enough. And the numbers clearly show that. Okay? When 2/3 of our population are still cooking using, still exposed to these very high levels of indoor air pollution, not enough. Especially when there are solutions that are available and we're not prioritizing it. It's not enough. One. Second, I think what we need to focus on is even when there are programs, whether we talk about the Pradhan Mantri Ujala program in India or other programs in the neighboring countries, there is a need for follow-up monitoring to ensure that the objectives are being met. Okay, so quality control, quality assurance, and all that is so much important, because cooking is not something you do once and it's done, right? It happens every day, and just by introducing a new type of stove or a new type of fuel, it doesn't end there. So I think quality control, quality assurance is very important, and that's what people need to focus on, both in the development sector as well as in the academic sector. Thank you.
Perfect. Thank you for giving me the segue to my question to my other two panelists as well, because the question to the other two was going to be essentially, we've seen significant strides made in India in terms of access to clean fuels like LPG over the last 5 years or so, thanks to the Ujjwala Yojana. But several surveys have shown us that the challenge continues to be the issue of sustained and exclusive use of clean fuels. And how do you see that challenge being overcome as we move forward? And what perhaps Pallavi, you can answer that, and Dr. Balakrishnan, you can give us an idea of how work that you are carrying out right now could help us answer those questions around sustained and exclusive use.
Yeah, I think I would, maybe just offer this notion that we know technologically what solutions work, but there are, as Bhushan sort of referenced, there are also behavioral challenges and other, broader like economic issues that relate to sustained usage of cleaner fuels, and a more careful lens into how we can address those pieces. Now that we know access is not our biggest impediment, trying to bring in a more nuanced understanding of what makes people, use LPG or other fuels on a more sustained basis and integrate that kind of knowledge into decision making and policy would be a good approach to go to the next step.
Thank you. Dr. Balakrishnan?
Yeah, I wanted to sort of, conclude with by saying that, mitigating household air pollution is the lowest hanging fruit that we have to meet with the goals set by the National Clean Air Program. Multiple sectoral interventions have been proposed, but if the recognition that mitigating household emissions is a major benefit, has a major benefit for improving ambient concentrations, and Mr. Bhushan Thulazar was saying about, Nepal's ambient air quality problems are as much by the Indo-Gangetic Plains household emissions as it is by the other type of emissions. So it's not even just within national, but even transboundary expectations are met. But within India, if that can be made a part of the discourse, then we stand the best chance of finding investments that would really accelerate the transition to clean cooking. It is a national cleaner agenda, it is a development agenda, it is a women and children's health agenda. Multiple things can start coming together. And this would give us the best, way of moving forward. And we don't need any more evidence for that. Is the health and evidence, in need of greater strengthening? The RCTs are going to come, we may find effects, we may not find effects. There are multiple things happening in these poor neighborhoods, and it's not easy to sort of demonstrate the health benefits very easily. But nevertheless, sort of really meeting the national ambient air quality standards by mitigating household-related emissions really should be one submission that I want to place to the organizers to take this forward. That's my take on it.
Thank you, ma'am. And I think there may be other questions, but I think we'll try and pass them on to the panelists after this session, Pratima. I think just to quickly wrap up, I want to thank all of our panelists for their sort of fantastic presentations covering the gamut of how household or indoor air pollution affects health, methods for exposure assessment that have really been pioneered in India and South Asia and have informed policy across not just this region but other regions around the world, and how we are really pioneering this work around the epidemiological assessments of health impacts as well in this particular region. And I think the takeaway across all of this is really the depth and breadth of the work that has been carried out in this particular domain is really significant over the last 30 years. And I think there's really no excuse for inaction on household air pollution, given that it is, as you, Dr. Balakrishnan, put it, the lowest hanging fruit that we can have if we want to improve air quality in India. So with that, I'll hand over to Pratima, and thank you to all who attended this session.
Thank you, Bhargav, for efficiently managing the panel. Really appreciate, informing everyone about their time. Thank you, Dr. Kalpana, Dr. Bhushan, and Dr. Pallavi for making excellent presentations. Some really key points that came out from the session that I really like was when Dr. Kalpana said that we have an understanding of source profile at really good resolution, and we should be acting on that rather than trying to do more epi studies. So yes, this is the message that we need to take to the policymakers and understand what are the implementation challenges. Also, another important thing, yes, we have policies in place, but what is missing is the quality control and monitoring of these programs on ground. So definitely we will take this dialogue forward and try to bring a change on ground. Thank you everyone for having for being here on the panel. Thank you.
Thank you.
Thank you. Bye.
With this, we move on to our next session that will focus on air quality inequality, air pollution inequality, and occupational health exposure. We understand that air pollution inequality between the developed and less developed regions, among genders, among age groups, need to be studied and assessed. The lack of initiatives in assessing health risk to people exposed to air pollution while they are occupied in different tasks such as mining sector, stubble burning area, or cooking or other industrial zones will be another focal point of discussion of this session. With this, I would want to invite Dr. Shweta Yadav, Assistant Professor, Department of Environmental Science, Central University of Jammu. She's a vibrant atmospheric scientist working in the fragile and less studied ecosystem of Himalayan region. She is a Fulbright Kalam Climate Fellow. She is also a knowledge partner under National Clean Air Program and is also the coordinator of the Himalayan Aerosol Research Instrument Facility, a dedicated instrument facility established in collaboration with the J&K Pollution Control Board for conducting source apportionment studies. With this, over to you, Dr. Shweta.
Thank you so much, Dr. Pratima, for the brief introduction, and I extend a very warm welcome to all the expert speakers and attendees in session 2 of day 2 of ICAS 2021. So today we are talking about priority areas of intervention, and in session 2 we'll be focusing on air pollution, inequality and occupational health exposure. So we all know that if we are really worried about the current air pollution crisis ongoing in India and worldwide, we need to first understand and examine the priority areas of interventions. And to discuss this, we have galaxy of speakers with us. Not taking much time, I would like to introduce first speaker of this session. That is speaker 1 is Dr. Ravindra Keval. So it gives me immense pleasure in introducing Dr. Keval. He is having some outstanding contribution in the field of air pollution and health. He is additional professor, Department of Community Medicine and School of Public Health, PG IMER, Chandigarh. And Dr. Keval is the nodal facilitator for the DHR Fellowship Training Program in Environmental Health. He has also developed health adaptation plan under National Program on Air Pollution and Climate Change for Ministry of Health. So recipient of several awards, I think Dr. Keval is the best person to throw light on this issue of occupational health exposure. In his talk, he is going to focus on industrial mining clusters and stubble burning. So please join me in inviting Dr. Keval for his talk. Over to you, sir.
Thank you, Dr. Yadav and Dr. Singh. Am I audible? So first of all, it's a pleasure to be here, and I could see that Professor Vij is here, my colleague Ajay Nagpuri is there, and Sweta, and means they are like, so it's a kind of a, means I can say that it's more closed member I could see here. So my screen, please close confidential window. Thank you. So as highlighted, today we are going to discuss basically the lack of understanding and initiative on occupational health exposure. I think we know that workers globally, they are affected by their work profession. Why? Because every person has an occupation, and every occupation has some hazard. Occupation hazard cannot be cured, but they can be prevented. And that is where we need to focus upon to prevent these environmental and occupational hazard. So they could be, as you know, 4 types like chemical, biological, physical, and psychological. So how these are affecting our population and how we can minimize, we are going to discuss a bit about this. So coming to the broad definition, it is an area of work where basically we can say that promoting and maintaining highest degree of physical, mental, and social well-being of the worker in all occupation. Or in simple word, I can say that we are adapting to work to the human being. So that is the broad definition when we talk about occupational hazard. And occupational exposure at a workplace may cause short-term effect or long-term effect, and we could see in my coming slide that starting from, you can say, injuries to minor or injuries to long-term impact like myocardial infarction or having a non-communicable disease. So these are some of the impact, and we know that one of the noted disease like silicosis. So if we talk about what is the impact, you could see that 2 million deaths, these are preventable deaths from unsafe work practices. And either they may be related to the work-related disease or directly disease. And that have impact on our economy. Means 4 to 6% of GDP, and specifically if we talk about countries like developing or you can lower and middle income countries, it is really impacting a lot where the health budget is around 1%. So this shows that we could be having cancer, and roughly 55% of the cancer could be related to the working conditions. Then coming to the respiratory disorder or ailment, you could see that more than 44% actually could be related to the workplace condition. And then how we work, basically how we are sitting, how we are adapted to the work. You might have seen people doing without following the ergonomically designed system or mechanism. and that lead to several musculoskeletal disorder. And of course, the work-related, you can say, stress, overwork, or harassment could be related to 2% of this mental disorder. So when we are talking about a agrarian state from where we are representing Punjab or Haryana, or you can say nearby region. So this is the sector which is basically an unorganized sector where we see most of the rules and regulation, they are for the organized sector. And when we are talking about this, we will know that our 70% of the rural house, they live at a location where the even if you have rule regulation and policy, they cannot be really in place. So if we talk about how they could be exposed or what are the risks there, it could be pesticide in terms of chemicals, talking about toxic or allergen. So you could see there are dust or there are some specific chemicals. I have seen even these now means unauthorized waste industry, means electronic waste industry, which are now moving towards the rural area and creating these metals problem. And then carcinogenic substance, either there are several substances which are present in pesticide, and there are other you can say workplace exposure is also there. And then there is a extreme weather. I hope you are aware that workplace working group 6 report was recently released, and that also highlighted the condition. And there was a recently, just few days before, a paper about the extreme weather event and its impact on the human health. So all these in near future will impact the rural population, and specifically in our unorganized sector. So talking about agriculture and occupational exposure, you could see that apart from what everyone is having, they have additional exposure. Either it is stubble burning, and these emissions we have estimated, and you could see who is the first victim. If we talk about, it is the farmer, their near and dear family, their livestock, and all these will be affected. So if we look at a farmer who is doing these practices following, so whenever we talk about the impact, we must understand that if our India is an agrarian country, and where we see these impact from the agriculture activities, it is basically the farmers and those who are associated with the agriculture practices. They are the first victim. Either it is the season may comes, harvesting, residual burning, tillage, sowing, all will contribute to the emissions. And when I'm talking about these emissions, so these emissions are toxic emission, either fine particles or carcinogens like benzene, toluene, xylene, or pesticide, which could have therapeutic or you can say genetic impact. So this is how we are seeing, not only in terms of basically crop residue burning. Here you will see that they might be aware, but personal protective equipment are lacking. So who is then again first victim of these occupational hazard? The poorest of the poor, and those who are, we are saying, is the our bread producer. So not only in this sector, basically, we have looked at most of the sector where the mining activities are going on, and you will see they all are practicing in a some way that where the protections, the basic, you can say, preventive strategies are missing. And if you remember, I mentioned that every person has an occupation, and you can not cure them, but you can prevent them, and that is the strategy which we need to adopt. Talking about the coal mining activities, probably you cannot say a particular disease which may not be associated with the coal mining. So basically, looking at the all the health impact and effect, the coal mining is responsible because of either heavy metal, or you can say polycyclic aromatic carbon compound like this. Basically, they are having starting from ischemic, you can say, disease to cardiovascular disease, cancer, and other. So based on this, basically, there was a study having an international panel, and they estimated that roughly 7 million deaths could be attributed to the air pollution. At the same time, they also agreed with various Institute of Health metric, you can say, estimate basically. Yes, please. So it is a significant, you can say, burden. And if we talk about the world population, you will see that out of 6, 1 death could be, which is a preventable death, could be attributed to the either air pollution or this work-related occupational hazard. So when we talk about, are there a way basically, or what is the impact? So there is, as I said, there is all these disorders could be related to the occupational hazard. And at the same time, the Director General of Factory Advice Services and Labor Institute, they are working, they are making guidelines, and there have been a recent initiative by the current government where the policies are, you can say, changing. So we can see means the changes are happening on a rapid pace. So when we talk about means how we can minimize this burden or something, so government of Punjab also introduced first of all Mission Tandrust. What is the Mission Tandrust? Is basically healthiest state with the healthy people. Then sustainable growth through sustainable policies or healthy policies, and they are basically an active partner under National Clean Air Program. So if we talk about there is a, okay, I thought my slides are not moving, but they are. Probably somewhere something happened.
Your slides are not visible to us anymore, and you have 1 minute left. I'm sorry.
Go ahead. So when we talk about means how we can go ahead. So as I said that Punjab has initiated Mission Tandrust. They are active partner in National Clean Air Program, and all the known attainment cities, they are making good progress to achieve the National Clean Air Program goal. So in term of talking means, you know that sustainable development goal could be related to these environment and occupational health hazard, and I'm sure by introducing proper framework of tracking rural and urban pollution and specifically PM 2.5, we can address this. Then tracking should be extended to associated chemicals and heavy metal with different particulate fraction. So we need to also develop methodologies to collect data on death and disabilities, you can say, caused by outdoor and indoor pollution, and that later on can be extended to heavy metal and other toxic, you can say, contamination, including the soil. Basically, as we are seeing in Punjab area or in a region where the groundwater toxicity is also becoming a problem. Then we need to also extend on the methodologies related to that and disabilities, and having a specific target on air, water, and soil pollution. So this mortality and morbidity data should be accessible annually to ensure continuous monitoring of the disease statistics. Specifically, if we are talking about incident death related to chronic obstructive pulmonary disease, lower respiratory infection in children, incident
conclude, you need to conclude because of paucity of time. I'm so sorry.
So we need to develop comprehensive data through, you can say, inventories of toxic waste site and assessment on data, you can say, having data on death and disability from the contaminated site. And I think through this, we can achieve, if we are addressing or we are targeting towards our sustainable goal. And this is achievable only through having a major focus on, we can say, environmental and occupational health concerns. So thank you.
Thank you so much, Dr. Keval, for the insightful presentation. And also, not only you discuss the problems, you also discuss the new intervention methods, and also what Punjab government is doing, some new missions and all. So it was really a very, insightful talk and thought-provoking also. Now we are moving to our next talk on air pollution inequality. So as we all know that globally the burden of diseases is like 9% from air pollution, but we also must know that this 9% has, it varies from 2% to 15%, like 2% for the developed regions and 15% to the underdeveloped. So there is a kind of disparity in air pollution also, and this brings air pollution inequality. So it's very, very important to understand this. And because of this air pollution inequality, only World Economic Forum says that by 2050, clean air could truly become the new global currency. So this is the time to invite and introduce our next speaker, Dr. Ajay Nagpuri. Dr. Ajay Nagpuri is head of Air Pollution Sustainable Cities Program, World Resources Institute. And Dr. Nagpuri specializes on developing research strategies in the area of air pollution and health risks. As he has a wide experience of working with several renowned institutions, I think he's the best suited expert to talk about air pollution inequality. And he'll be focusing on lack of focus on communities around landfills, slums, etc. So over to you, Dr. Nagpuri. Thanks.
Thank you, Dr. Shweta. Yeah, the presentation is already shared. So, you know that now I think most of the Indian cities are facing this air pollution problem. And we all are working towards making air better. I think, that I feel that if we really want to solve the problem, we need to work at a neighborhood level, intra-city level, or like a village level. Without that kind of understanding of the sources and air pollution, we would not be solve the problem efficiently. So in this regard, right now, I think, that the time is, because of the time constraint, I am going to only talk about the one part of my research. So right now I'm working on different sectors, like whether it's a construction, restaurants, eateries, household cooking, waste burning, vehicle, and I'm trying to understand and I'm trying to develop a methodology to assess the contribution of a different socioeconomic neighborhood at the intra-city level. So in this regard, I think today I'm only going to talk about like one of the method which we have developed is the municipal solid waste burning and how it varies across the neighborhood. Could you please go to the next slide, please?
Dr. Ajay, we have given you the keyboard access. You can change from your side as well.
Okay. Okay, let me. Okay, yeah, can you see? Okay. So this methodology, I think this methodology we have developed when I was in Minnesota with my Professor Professor Anu Ramaswamy. Currently now she is in Princeton University. So this is the municipal solid waste burning method which we have developed in year 2016. And this method we were trying to assess like how the waste burning varies across the neighborhoods, the different socioeconomic and infrastructure pattern. And now this method, I think now this method is globally accepted. Researchers from South Asia, Nepal, India, Pakistan, and Africa, they all are using this method because it's a very simple method to assess the infrastructure disparity as well as the air pollution inequality across the neighborhoods. So right now, I think this is the first work where we conducted this research in Delhi. So in Delhi, we were trying to assess like how the municipal solid waste burning is it's responsible for the air pollution in different neighborhoods with the different socioeconomic category. So for this study, what we did, we selected neighborhood with the different socioeconomic patterns in Delhi. I think this is the Brijpuri area and the Janpura and Safdarjung enclave. These all three neighborhoods are having distinguished socioeconomic and infrastructure pattern. So we applied this method in 2015-16. Recently, because right now I'm working on the developing a clean air action plan for a Surat city. So one of my colleagues, I think he also conducted a similar kind of survey in a Surat Municipal Corporation, at different neighborhoods of the Surat Municipal Corporation. And after this, we are going to apply this method again into the Indore city, where we are having another project. So the similar pattern, whether it's Delhi, Indore, or a Surat, or a Agra, what we are finding a similar pattern across the city. But we are seeing that most of the, I think, the low-income neighborhoods are having high municipal solid waste burning, followed by the middle-income SES and a high-income SES. So this is not like a one city problem. this problem is across the different city. So I think that when we are talking about like a sector like municipal solid waste management, so I feel that results of my studies indicate that we need to have a different strategies for the different kind of neighborhoods, because each neighborhood having a different characteristic in terms of the infrastructure, in terms of the people behavior, in terms of the socio-economic strata. So this is these are the composition figures which we have observed in a different neighborhoods. So you can see from these pictures, like, because we were looking for the municipal solid waste burning in a different neighborhood. So for that we conducted this survey in both winter and summer season, and now you can see that how the composition varies across the neighborhoods. The high neighborhoods you would find more like a garden waste, and during the winter time, and low income you would find a similar. I think the composition is almost similar to the, like, what is the normal composition of the generated waste. So it indicates that the municipal solid waste
Dr.
burning.
Ajay,
Yes.
we are still seeing your slide 3, the
Okay.
3 neighborhood selection. The slides are not changed. Do you want to change slides? Or
yes, please. Yeah. I'm on another slide. I think slide 6.
Okay. Okay, fine. We'll please just let us know when you want to change the slide. We will change it from here.
Okay. Yeah. So could you please go to slide 6?
Yes.
Slide 6 is the composition. Yes. So you can see that the composition of the municipal solid waste burn municipal solid waste is also varies across the neighborhood. Please go to next slide. So I think this is the research which we published, I think 3-4 years back, and that was the most of the newspaper has covered this research. It was about the Taj Mahal. And so after that, in a survey of different neighborhoods, we estimated like how much waste being burned by the total city population. What we observed in Delhi, it's about 2 to 3% of everyday generated waste was burned by the city in 2015, and that was 24% in Agra. So these are the old numbers. Please go to the next slide. Similar kind of I think analysis we did, and we also estimated the emissions of the municipal solid waste burning in different neighborhoods. And what we are finding that the poor neighborhood, the low income neighborhoods, which are already having the infrastructure disparities, are having high emissions from the municipal solid waste burning in a Surat city also. Please go to next slide. We also estimated like concentration of the air pollution associated with the municipal solid waste burning, and similarly we found similar pattern, like people with the low income area are highly exposed to the air pollution. That is, I think, it's an important finding. Please go to next slide. Yeah, so these are the health numbers. Like, we estimated the health risk associated with the waste burning, and we found like a majority of this health risk or premature mortalities are happening in the poor neighborhoods. Please next. So another thing is that, like, that we always talk about like a problem. So waste burning is happening, but why waste burning is happening? So after that, I published another paper. It's like a root cause of the waste burning. So for that, I think this was it's I think 2016 or 17. So I conducted an extensive survey of 4 different neighborhoods in the Delhi, and with the 3D sensor technologies to assess the waste composition and the waste accumulation on the ground. And what I found, like a rich area, the rich neighborhood, the waste collection efficiency in Delhi, yes, yeah, Delhi rich neighborhood is about I think 90, I think more than about 99%. Whereas the poor neighborhood, the waste collection efficiency is 67%. The overall, if you see the overall Delhi waste collection efficiency is 87%, according to my research. So I think that if some city says, oh, we have this much waste collection efficiency and there would be a less waste burning, I think we need to see that how it varies across the neighborhood, as according to the infrastructure and the socio-economic pattern. So this is the thing. The last figure I would like to show, could you please go to last 13 slide? I think this. So another thing, like which we were trying to, this is another research with my supervisor, Professor Anur Ramaswamy. So we are also trying to assess the contribution of different socioeconomic pattern, the population with the different socioeconomic status. And you can see that these blue bars are the rich people. The top blue bar is top 20% rich people in the different cities like Delhi, Coimbatore, Rajpur, and bottom this light the bottom one, before this orange bar is the poorest people. And you can see for the different sector, whether it's a car ownership, two-wheeler ownership. I think please go to the next slide. Uh, so if you can see here, like these blue bars show the contribution of different infrastructure or the vehicles or the different activities of the different socio-economic segment. You can see the rich people are contributing the highest amount of air pollution emissions, whether it's a transportation, whether it's I think it's LPG and kerosene, construction, but I think except the biomass burning and municipal solid waste burning. So, and even overall, if you see the contribution, I think again rich people are contributing. So I think that I'm just concluding here, like if you really want to solve the problem, we need to understand the ground situation, and we need to work at the intra-city level to assess the contribution of the different socioeconomic status of the people, as well as the infrastructure disparity. With this, I would stop. Thank you so much for your attention.
Thank you so much, Dr. Nagpuri, to finish within time. And thank you so much for discussing the case study from Delhi. I think the two talks are connecting to each other. Like whenever we are talking of occupational health exposure, or we are talking of air pollution inequality, we are talking of more exposure to the poor people, and somehow this social disparity is coming in. So thank you so much again. Now it's time to welcome our next speaker. The third talk of the session is on impact of stubble burning on the health of citizens and pollution contribution to the nearby areas. I welcome Professor Adarsh Palvik sir. And Professor Adarsh Palvik sir is Chairman, Punjab Pollution Control Board. With an incredible experience of more than 26 years, Dr. Vig is also Professor and former Head Department of Botanical and Environmental Sciences, Guru Nanak Dev University. Besides being on several national level committees, he is serving director UGC HRDC. I welcome you again, sir. Over to you.
Thank you, Shweta. I am audible. Hello. Thank you, organizer, for giving this opportunity. I could not understand. I was thinking that it could be a one-way lecture from my side. So, but that is not really happening. Anyhow, so I will not be presenting the whole slide because it has become a long kind of thing. And, so only gist of the things I will be trying to discuss, so that it is a very good effort of doing a panel discussion. And thank you, Shweta, to see you again here. I was not knowing who are the other panelists because I got only one single page of mine only. But anyhow, it is a two-day event and very well taken, and I am happy that despite coming from academics to this regulatory role, I think Pratima was calling me, and I immediately said yes. But again, you can see everything is there to do the pollution control board work. But why this was also important for me, because we are also taking this stubble burning issues at Punjab level, and it is very you can say not relevant at this time, need solution for that. And some solutions are being worked out, and almost they are very we are pushing on toward that thing. So just starting that this why this stubble burning happened. So I think we are always blaming the farmers. I should not blame the farmers. No doubt they are burning, but why this stubble burning started? This started with mechanization of the agriculture. Firstly, our scientists, we taught them to go for mechanization. When they go for mechanization, the manual cutting of the crop harvesting stopped, and then they were not having much options, and option was to burn, and then there was less labor, because once they have gone for mechanical kind and economy or so many, rather it's not economical, they are putting more, only time is less. but they have to burn. They are not going for mulching and all kind of thing. Then now we are looking for technologies to do in situ, you can say, solution for that. So one thing is that. Second is that it is always blamed in Delhi, sitting there, that this stubble burning is creating air pollution in Delhi and other areas, rather Punjab and Haryana and all that kind of thing. No doubt this is a problem which has to be taken care. So one, I feel that in situ solution is much more required. How we can do, what will be outcome, that needs to be discussed. We are also looking on that. Then one issue was that to regulate by imposing the law, by imposing the penalties, by imposing that they should not burn. No doubt, again, the farmers is a very sensitive issue. You have seen in the whole India that how much sensitive issue is there. Even pollution control board or local and awareness kind of things are going on to the farmers for not burning, but still they are burning. So this issue needs to be done. Then in situ, it is very difficult. So now happy seeders and so many new technique, direct sowing of the wheat is there. And then there is a very less time in the next sowing, so they need to do it fast, and labor is not available. मतलब एक आदत हमने उनको पहले मैकेनिज्म की डाल दिया, अब हम उनको वापस लाना चाहते हैं, तो बड़ा वो डिफिकल्ट काम हो रहा है, ठीक है. तो अब जो यहाँ बैठे, what they were doing to utilize this paddy stock, तो वो अपने आप में और समस्या है. How to utilize? इतनी प्रॉब्लम्स है, वो स्लाइडें लंबी हो जाएगी. मतलब पहले तो उसको काटना, फिर उसको उसकी बेल्स बनानी है, फिर उसको ट्रांसपोर्ट करना. जो आदमी यूज करना चाहता है उसके लिए रखना ही समस्या है, बिकॉज दे आर ड्राई मैटर, इट गोज फॉर बर्निंग. और अल्टरनेटिव्स बहुत है, जैसे हम खुद सॉलिड वेस्ट मैनेजमेंट करते हैं, वर्मी कंपोस्टिंग की जा सकती है, फॉडर यूज किया जाता है, बट ह्यूज अमाउंट, यू कैन इमेजिन, वो डाटा मेरे पास नहीं है, मतलब इतना 64% of the total in Punjab is being burnt, ऐसा डाटा मेरे पास है, और इतने मतलब क्विंटलों में वो है. तो वो सब ऑप्शंस हैं, all options are there and they are being worked out, but presently जो हमने फिर ये देखा भी, it should be used as a fuel in industries. So we have made a 3 kind of list, A, B, C. A are the industries, जैसे उसके कुछ नाम है, they are in Fatehgarh Sahib, Ropar, Setia mill is there, Shri Ganesh mill is there, the Sanjay Solvex. And why I'm taking names, because they are 100% utilizing this, और उनकी भी कैपेसिटी है. तो ये 4-5 इंडस्ट्री से तो काम खत्म नहीं होगा. फिर एक बी कैटेगरी की है, बिकॉज दे हैव टू चेंज द बॉयलर्स, दे नीड अ स्पेस टू स्टोर दैट. वो बी वाली वो है जिनको ये कुछ परसेंटेज यूज करेंगे. Then C is those who are pursuing them. So we are pursuing them. So like that. एक ये issue है. दूसरा, they are being used as a conversion in the brick. You can say what is called brick kilns, उनकी बनानी है ना, उनकी brick kilns बना के उसके भी फिर बायोमास यूटिलाइजेशन के हैं, बायोमास टू एनर्जी है, बायोमास टू इथेनॉल है. बट दिस इज, जितना भी इसको कर लोगे अच्छी बात है, दिस इज वेरी गुड, बट स्टिल मुझे लगता है ये 50% भी उसको पैडी को नहीं दे. बट दीज एफर्ट्स आर बीइंग conducted at pollution control board levels, Department of Punjab Science and Technology. It's well taken, बहुत जोर उसमें लग रहा है. और अभी उसमें जो ये इंडस्ट्री ये काम करेंगे उनको हम इंसेंटिव भी दे रहे हैं उनको, क्योंकि नेचुरली वो बॉयलर चेंज करने वाले, ये चेंज करने वाले हैं, ठीक है. और ये दिल्ली की पोल्यूशन की बात है, वो मुझे नहीं लगता इससे होता है, ठीक है, वो उनका अपना इशू है, वो एयर पोल्यूशन पहुंचता है, बट वी आर आल्सो, किसी को भी होगा, वो तो दिल्ली पहुंचे, पंजाब में रहे, दे आर अफेक्टिंग, एंड वो ऑल इफेक्ट, यू आर नोइंग these good microbes they are burning, all, it's not good for any health, and there are so many dangerous kind of issues. और health वाली बात तो everybody knows, respiratory problems, infertility, total invisible हो जाता है system, ठीक है. So ये कुछ efforts है going on. So I think not taking much time, we will have more discussion. This is all from my side, and it's a good effort, and I congratulate all the organizer panelists for being can say organizing this clean air India. At least हमने सोचा है उसको ठीक करेंगे. और मुझे तो फिर बाद में यही लगता है भी, instead of putting the blames on anybody else, I should correct myself. I should correct my organization, being in university, being in institution. मैं जितना ठीक कर सकता हूँ, तब मुझे लगता है मैं दूसरों को कहने के लिए कहूँ. So thank you very much. Good day. All the best.
Thank you so much, sir, for your insightful talk. And I really liked your tagline that farmers are not responsible and they should not be, responsible for this pollution. So you talked about, sir, about these interventions, about the industries which are coming up with the boilers and all. So now you are from Guru Nanak Dev University to Chairman Pollution Control Board, Punjab Pollution Control Board. So how you see, sir, this opportunity, like what can be done from the Punjab Pollution Control Board for this problem? Because stubble burning is a problem which is seen again and again. Every year we see the problem of pollution in Delhi and adjoining areas.
Recently, we have given one project to Punjab State Council that what amount of the paddy can be utilized in the existing boiler without converting. क्योंकि जब इंडस्ट्री को कोई चीज कन्वर्ट करने के लिए कहता था, फिर वो उनको कॉस्ट और बाकी चीजें इट्स नॉट इजी, तो उस तरह की एक स्टडी भी चल रही है. And recently I was sitting with PAU teacher and he was earlier in the Leh and Ladakh. कल की बात ही है, he is head of the forestry. He told that अभी हम ये पैडी स्ट्रॉ राजस्थान भी जा रही है, ठीक है ना. मैं फिर बात करूँ, इतना ह्यूज है, एफर्ट्स आर वेरी गुड, रिजल्ट्स विल उसके आएंगे, बट एक जिसको होता है ना, एक जड़ से समस्या खत्म करने वाली है, वो भी होगा मुझे लगता है साल में. तो मैं बार बार वो कह रहा हूँ, जड़ तो पहले हमने पैदा की, अब फार्मर्स को हम कर रहे हैं. तो जब हम मैकेनाइजेशन पे नहीं जाते तो मुझे लगता है ये चीजें नहीं, ठीक है ना. वो तो कई बार कहता ब्लाइंडली टेक्नोलॉजी को फॉलो करें. मैं लेह लद्दाख की बात कर रहा था. देयर इज ए नीड ऑफ फॉडर इन लेह लद्दाख. आप तो श्वेता भी जम्मू में बैठी हैं और वहां पे इनको पहाड़ लोगों को पता, वो बंद हो जाता है सारे रास्ते, ठीक है, और मिलिट्री इज देयर और पब्लिक. एक तो फॉडर उनको जरूरत है और दूसरा फ्यूल, फॉडर और फ्यूल दोनों वहां पे. सो दिस कुड बी ए वेरी गुड अल्टरनेटिव. ये अभी कल ही बात हुई है और जो पता चला भी ऑलरेडी वहां से जो मिलिट्री है वो कहीं साउथ से फॉडर मंगाती है, फ्यूल मंगाती है. तो हम तो पास है उनके, ठीक है ना, तब भी वो कितना जाएगा, बट इट्स ए गुड काइंड ऑफ थिंग. सो पोल्यूशन कंट्रोल इज लुकिंग ऑल द पॉसिबिलिटी. जैसे मैंने फॉडर की बात की, कंपोस्ट की बात की, ब्रिक क्लीन बनाने की बात की, बायोमास की है, इथेनॉल की है, शुगर केन की है, सब में कहाँ कितनी परसेंटेज हो जाए वो हम मैक्सिमम अपनी तरफ से कोशिश करें along with the Punjab government. Thank you.
Thank you so much, sir, for the positive comments on this. And we really foresee that we'll find some solutions to the problem soon. And now Dr. Keval is also with us. So, sir, this is time for panel discussion. So I was trying to connect your talk because you were talking about occupational health exposure and you were talking about our agrarian society. So how do you think that this stubble burning problem and it's like connect to the workplace exposure things in the farms and also? What is your comment on this?
Thank you, Sweta. It's a very interesting question. If you look at, first of all, this agriculture burning or farming is an unorganized sector. So whatever rules or policy we have, they do not likely imposed as they are imposed in the industry. So if you look at what could be the impact, I would like to share with you the statistics which we calculated for Punjab area. Basically, the work-related mortality are around somewhere 7,500. If we talk about mortality due to occupational injuries, they are somewhere around 1,200. And if we talk about total work population is 10 million. So if we work for these issues, we could avert roughly 10,000 preventable deaths. So now you can see that means the impact of working only on work related. I'm not talking about air pollution and other things, because we are also working in this direction, and the mortality and morbidity you can say associated will be significantly higher. So what we need to think about or do basically is how we now cover these rural population and specifically the organized sector in terms of occupational hazard, which is still a challenge because whenever we talk, the 90% of the population or 90% of our workforce that work in an unorganized sector. So there is a public participation, or you can say there is a need of policies and formulation so that we can prevent these adverse impact on health caused by their working condition. And I'm sure that with the involvement of the policies and also the public, these could be easily addressed.
Thank you so much, Dr. Keval. So I'm coming to Dr. Nagpuri about this study which you have conducted. So I want to know, like, what were the socio-economic variables considered in classifying different neighborhoods in this study?
So when we were classifying the neighborhoods, we were considering income and the infrastructure profile of the neighbor households. You know, the Census of India data provides the household amenities and assets for each neighborhood. So we use that data. We also use the income, monthly per capita expenditure, as well as the before the survey. We also try to assess the waste management infrastructure in that neighborhood. For example, like how many dustbins are there, how many employees are working there, all these parameters we assess before conducting the survey.
So what do you think that what is the current policy weakness about solid waste burning and its management in mega city like Delhi?
I feel that we need to because you know that some neighborhoods are very affluent. If I would have, I think in rich neighborhood, if there is some waste burning or the waste accumulation, people can directly call the authority, and there would be I think immediate action. But it's not happening in the rich poor neighborhoods. So in poor neighborhood do not have enough space for the dustbins. You know, it requires a daily waste collection, which is not happening because of the street population density. So we need to work, you know, like a decentralized way. One policy we cannot apply one policy to the entire city. We need to think about different neighborhoods. Also, like if you see the rich neighborhood, there are 3-4 infrastructure working simultaneously. For example, rich neighborhoods are having a private waste collectors from their household. They do have the trucks coming to their neighborhood. There is a street sweepers is there, but in poor neighborhoods, only they are depending on this truck, which is coming, I think, daily. So that is the thing. So there is an infrastructure disparity. So we need to think in a way, like if rich neighborhood can afford this kind of infrastructure, we can say that you can do I think you could arrange your own waste management, and we will focus on the poor neighborhood. So that kind of strategies we can apply.
Thank you so much. So there is one last question coming up. I think it will be posed for all the panelists. Dr. Vig is still with us, I believe. So with respect to industries, what is the right area for investment shifting to lesser polluting energy or emission control? So they are saying, like, with respect to industries, what is the right area for investment? So sir, I'll pose this question to you. Professor Adarsh, sir. So the question is that
बताइए.
So with respect to industries, what is the right area for investment, like shifting to lesser polluting energy or emission control?
समझ लगी. मतलब वैसे तो इंडस्ट्री बहुत वेरिएबल है ना, हर इंडस्ट्री की अपनी रिक्वायरमेंट है. यू कैन नॉट कोरिलेट एट वन पॉइंट ऑफ व्यू, है ना. तो जैसे हम इसमें जो बॉयलर्स है या बाकी यूज, प्लीज.
जी sir, question from one of the attendees that if we are talking of industries, so what is the right area of investment? Like they should go for lesser polluting energy or they should go for emission control strategies?
ये तो उसके ऊपर है ना, मेरे को क्या पता. वही तो मैं कह रहा हूँ. मतलब वो तो देखा ना, यू आर, देखो इंडस्ट्री इज फॉर बिजनेस. तो जब पोल्यूशन कंट्रोल बोर्ड है, बाकी हम तो बार बार रविंद्र जी बैठे हैं, बाकी अजय जी हैं, बाकी हम तो उनको बार बार समझा रहे हैं, भाई योर प्राइमरी एम शुड बी नॉट टू पोल्यूट. बट उनके मन में है जी प्राइमरी एम इज टू प्रोडक्शन, गेट मनी. तो उनको बात वो तो जब वो समझ आ जाएगी तो आदमी वो पहले सोचेगा भी आई हैव टू प्रोटेक्ट वाटर हेयर. यहाँ तो बहस वो होती है, नहीं जी आप कह रहे हो ये हमने ट्रीटमेंट प्लांट लगाया नहीं, हमने लगाया हुआ है. हमारे बंदे कहते हैं जी आपके वो आ रहे नहीं जी हमने तो ठीक कर लिया. मतलब जब अंदर से उनको नहीं है वो इश्यू फिर उसमें खड़ा नहीं होता. जब वो, तो मैं तो कई बार उनको कहता हूँ, मुझे लगता है कि आप पोल्यूशन कंट्रोल की बात नहीं मानोगे जब आपके बच्चे आपको कहेंगे ना भैया आपकी इंडस्ट्री पोल्यूट कर रही है, तब आपको कुछ रियलाइज हो. तो ये दिस इज अ पार्ट ऑफ द इन्वेस्टमेंट. इसलिए थोड़ा चेंज करने वाले हैं. वी आर आल्सो गोइंग टुवर्ड्स दैट. सो वंस द परसेप्शन विल चेंज फॉर द इंडस्ट्री, so when they will feel that environment protection has to go hand in hand with the development and hand in hand with the income and all that kind of thing, I think when they are ready, it's not that they have not capacity, they have abundant capacity. Industry के पास बहुत कैपेसिटी है। सिर्फ मुझे लगता है वही बात जो मैं फार्मर्स के केस में कह रहा था, हमने जब उनको इंडस्ट्री लगाने के लिए बताया तो इतना ही बताया कि प्रोडक्शन तक जाओ। इंडस्ट्री सारे आई शुड मतलब मैं थोड़ा दुख से कह रहा हूँ, जो इंजीनियर्स हैं, साइंटिस्ट हैं, उन्होंने उसको प्रोडक्शन तक बताया, उसको ये नहीं बताया भैया तुम्हारा ये पानी गंदा निकलेगा, हवा गंदी होगी, तो पहले ही ऐसी चिमनीज लगाओ, पहले ऐसे ट्रीटमेंट प्लांट लाओ। रादर जिसको कहते हैं ना भी, जब आप मतलब घर बनाते हो तो ये आप पहले सोचते हो भी उसमें मतलब अच्छी चीजें हो, मेरा स्वास्थ्य ना बिगड़े, मेरा ये ना बिगड़े, तो यहाँ भी ये सोचना पड़ेगा। तो फिर मुझे लगता है इंडस्ट्री भी ठीक हो जाएगा, कर रहे हैं। दैट इज ए मतलब, और मेरे जितना देखा, मैं 10-12% की बात कर रहा हूँ जो थोड़ा अड़ते हैं, अदरवाइज 98% लोग हैं वो कहते हैं हाँ हमें, हम चाहते हैं अब करना। अब नाउ वी हैव अंडरस्टूड भी ये बात हमारे लिए ठीक है, एंड वी वांट टू प्रोटेक्ट द एनवायरनमेंट, एंड द डे विल कम एंड व्हेन दोस काइंड ऑफ थिंग विल हैपन, restoration of environment will be done. But then the Punjab will be known for its good ecology. आजकल it's known for bad ecology. वही बात एयर वाली पंजाब की, जो ये बर्निंग का इशू है, बाकी इशू है, वाटर का बहुत जबरदस्त इशू है, सॉइल का, सब जगह मुझे तो लगता है समझ नहीं आ रही, पर वो चेंज होगा। वी आर वेरी होपफुल। थैंक यू वेरी मच।
Definitely. Thank you so much, sir. Looking at the paucity of time, we need to close this session because very interesting conversations are going on. And I'm very thankful to all the expert speakers for their insightful presentations. And itself, the galaxy of speakers make a very good team for seeking solutions to the problem. We have Chairman Pollution Control Board, we have a senior professor from PGIMER, and we have Dr. Nagpuri from World Resources Institute. So I think we'll definitely find some solutions to this problem. With this, I think I thank once again the expert speakers for wonderful presentations and insightful conversations. Thank you so much.
Thank you,
so, Dr. Fatima.
Thank you, Ji. Thank you all. Best of luck.
Professor Viz and Dr. Nagpuri.
Thank you, Ji.
Thank you, Dr. Shweta. Thank you, Dr. Shweta, for chairing the session, and thank you, Chairman Sir, Dr. Nagpuri and Dr. Ravindra. Some very nice points that came out, and I really want to highlight what Dr. Ravindra said, that occupational hazards can't be cured, but they can definitely be prevented. And that is why we need to have access to data about mortality and morbidity from the occupational various sectors. And very interesting aspect that Professor Adarsh mentioned, that we will have to start looking from the very right moment when we design our industries, when an environmental impact assessment is carried out. From that point, we need to ensure that an industry has control techniques in place or is planned for future based on whatever the production capacity or the type of industry it is. So I think these are some of the fundamental aspects that we will have to include in the framework itself rather than targeting the industries later on. So interesting session. I thank everyone, all the panelists and the session chairs for contributing to the discussion. Thank you, everyone.
Thank you. We can leave. Thank you, Ji. Good day.
Moving on to our last and the final session, which focuses on pathways towards achieving clean air for India, benefits of Clean Air Action Plan in cities. Having understood that indoor and occupational challenges, we also need to now address implementation challenges and governance structure in our cities, adopting global best practices and initiating public-private partnership for achieving a national clean air program targets. So in collaboration with various city government departments, we need to identify what these implementation challenges are and engage to find the solution. And to discuss this, I now introduce our session chair, Mr. Shiri Sinha, the Director, Climate Department, Children Investment Fund Foundation. He leads the India climate portfolio, including clean energy transition, power, industries, transportation sector, solutions for air pollution and sustainable cooling. Apart from regenerative agricultural, sustainable finance and climate policy. He also manages energy transition in South Asia and Southeast Asia and looks after the global program and climate ambition and transparency. In a career spanning over 25 years in policy making and program implementation, Shiri has worked in several national, bilateral, and international organizations. We are happy to have you here, Shiri, to chair the session. Over to you.
Thank you, Pratima. I hope it's audio is fine. And thank you very much for the kind introduction and for inviting me to be part of this India Clean Air Summit and also to moderate what I hope will turn out to be an interesting concluding session on pathways for achieving clean air for Indian cities. The discussion during the session, I hope, will also enrich some of the key messages that is emerging or have emerged from the sessions that you had yesterday and the sessions before. And it was very lovely to hear some of the earlier speakers and panelists talking about the challenges which faced with the farmers or with the industries. As one of the largest global philanthropy working on children, we at SIF are seeing that children are fast becoming collateral damage of multiple global crises, and one of them being the intergenerational burden of climate and environmental disruptions. We continue to see that public and private funds support very high carbon and resource intensive systems, or they end up funding incorrect or inappropriate solutions like the one that was inaugurated last week to clean Delhi's air. Our experience shows that for systemic long-term solutions for addressing the challenges of air pollution, we need to focus on three interrelated aspects. One is about building evidence base on air quality that can be used strategically to inform policy solutions, including understanding credible localized evidence on health and economic impacts of air pollution. The second on informing and supporting implementation of sectoral policy solutions, frameworks, and governance systems that guide a well-funded and coordinated response to tackling the issue. And third, which is to create societal pressure by building narratives and awareness among key stakeholders of the extent and impact of air pollution, and to motivate action that leads to clear solutions. So for the session today, in my role as moderator, what I'm going to use is use these three pillars as a guiding framework. And we have three very well-known air quality experts that I will request them to keep the session objective as they respond to the questions. And in the end, I'll come back to them to offer key recommendations and pathways. That's the objective for this particular session. But before we deep dive into each of these experts, let me first introduce them. We have Dr. Sachidanand Tripathi, who's a senior professor at Department of Civil Engineering at IIT Kanpur, and he's a well-known air quality expert. If you want to work on air quality, you need to first speak to Professor Tripathi, otherwise your work will never be up to the mark. A very prestigious and acclaimed career with awards like Shanti Swarup Bhatnagar Award and J.C. Bose National Fellowship. Professor Tripathi is also the coordinator of the National Knowledge Network, which has been formed under the National Clean Air Program. And he's also, of course, an expert member of the steering committee of NCAP. We have Mr. Iyad Kerbek, who is the director of air quality program at C40, and he's responsible for the development and delivery of C40's global air quality strategy and work that happens in several of the cities. He previously worked on air quality, climate, and public health with the City of New York, and also has served as the executive director of the air quality program at the New York City Department of Health. And finally, our third speaker is Mr. Chandra Bhushan, who is the CEO of the International Forum for Environment, Sustainability and Technology, or iForest, which is a new but very fast-growing think tank in India. He's also a member of the National Knowledge Network and expert member of several of the committees, including that of the BASIC, and has been awarded as the UN Environment Program Ozone Award in 2017 for his contribution for the framing of the Kigali amendments to the Montreal Protocol. So that's our three expert panels, and I hope through the set of questions and discussion that we'd like to have with them, we will be able to provide some very interesting insights into it. So just let me try and kind of give a structure to the discussion. So the idea is to make this more as a conversation. So this is my request to all the three panelists. So what I'll do is take the next 30 minutes by dividing this into two rounds of questions, which I have for each of the panelists. We will then follow up with the Q&A round, and I would request all the participants who are on the call attending this webinar to please type in your questions on the chat box of the Q&A function. And towards the end, after the 30 minutes, I will kind of take 10 minutes of the time to pose this question back to our panelists. If you want a specific question to a panelist, just mark it to them, and I'll take that into them. Otherwise, I'll invite all the panelists to respond to these questions. So without taking further time, and I thought, let me start with the first pillar of building on the evidence base. And I wanted to invite Professor Tripathi to reflect on the evidence-based requirement, linking it to the National Clean Air Program. Given that the National Clean Air Program, or NCAP, was launched about 2 years back, where do we stand today on NCAP as a program? And more specifically, one of the key pillars of the NCAP was to improve on air quality monitoring. So where do we stand on the progress what we are making collectively in the country on improving our data quality and availability of data? The second part of my question to you, Professor Tripathi, is that the NCAP sets a target of by 2024, 20 to 30% reduction that the cities have to achieve in their particulate PM measurements. Do you think, is that realistic, or do you think it will be achievable within the given designated time frame that we have another 3 years into the NCAP? And how do you think that it can be made more holistic and sustainable? And my last question linked on this is that you and your team has very recently did a very interesting project in Mumbai where you linked developed a network of hybrid model for air quality monitoring, combining low-cost sensors with reference-grade monitors. So if you could highlight some lessons from the Mumbai experience and how you see this evolving into strengthen the air quality monitoring or the evidence base moving forward into the country. So Professor Tripathi, floor is yours.
Thank you, Mr. Sinha. There are quite a few. I think I got to remember all of them. But good to see Chandra and good to see other panelists as well as Dr. Singh. As you rightly noted, that NCAP was launched in January 2019, and that rests on mainly 3 pillars: that data and science, and second is capacity and institution building, and third is mitigation across sectors. And the 5 sectors they identified are basically industries, agriculture, road dust, automobile or traffic, and municipal waste. And what you see that in just in 2.5 years, significant progress have been made in all 3. And I will list all 3. Why do I say that? You see, prior to 2019, we had a segmented approach towards dealing with the menace of air pollution in the country. We were, most of the time, we were talking about a particular region, for example, NCR, or a particular city. We did not have an overarching framework to deal with this problem. Now, what NCAP has done in that is that it has given you a national framework, which gives you a huge opportunity for developing a collaborative and coordinated effort at the national level, between states, and at city levels. That's what I see is a paradigm shifting that has happened since NCAP was launched. Now, if you see where we are currently in monitoring, if you notice that in 2019, we had about 180 CAQMS in the country and just about 500 odd manual monitoring. And currently that CAQMS has increased from 180 to about 280. But I would say that definitely we have more scope to increase the number of CAQMS and the scale of monitoring in the country. But at the same time, what you notice that there's a lot of thinking that is going on to adopt the hybrid monitoring. That is bringing some of the alternative new technologies, for example, sensors and maybe satellite-based PM or gas monitoring into this entire framework. So I believe that next few months to a year, we might see a rapid scaling of the monitoring network across the country. Your second question was where do NCAP currently stand? So you notice that since NCAP was launched, now 130 cities have been brought into the ambit of NCAP. These are non-attainment cities, which are basically designated based on some values of PM10. To my understanding, all these cities have developed their own action plans. It could be true that They are not perfect, but definitely we have some plans to act upon. What we are also seeing that now states and union territories, they are working on a state level plans. So definitely, probably in a year or so, we have plans across the country to basically work towards achieving the target of 30% reduction in PM 2.5. And there what we see the real progress is going to happen. Now, what you also see that what NCAP has also led to is certain other programs. I will just list few of them which have been announced at the national level. For example, look at Ujjwala 2. Ujjwala 1 had, that is Prime Minister's LPG, Prime Minister's scheme, LPG scheme. That has already a very significant effect on cutting down the PM and gases in the hinterlands of India. And I believe Ujjwala 2 definitely would have increased and substantial positive effect on people's health, and of course, reducing pollution in the rural India. Certainly we have seen when we have done something, we have looked into that effect of Ujjwala in different parts of the country. Then there is another mission called National Biomass Mission. Now that is going to look into in a very comprehensive way how the biomass from different sectors can be utilized for various purposes, for clean energy and for other purposes. We have e-mobility. We have a large program for helping the farmers so that they can shift. Certainly, there can be a seamless shift to the next crop without having to burn the crop residue. And there are many such programs. I just have listed few of them, which definitely will have very synergistic effect on achieving the NCAP goals. If you look at the regional level, what NCAP has also done, that for NCR, for example, there are 3 or 4 major policy interventions because of NCAP that has happened. I would like to list them as well. Construction of these 2 large ring roads, shifting to clean fuel across the industries. So maybe there are just 25% top industries or big industries which are still need shifting, transitioning to the clean fuel. Then installation of SEMS across all industries. Earlier, it was only installed in what they call red industries. And then transition to cleaner brick kiln technologies. And these major interventions, which were done in coordination with NCAP, has led to some improvement in NCR air. And 2 independent data sets actually show that. The data sets from the government monitors in Delhi NCR, and independently, the data which has been used from satellite-based PM 2.5, they both show that compared to 2015 or even 17, there is 12 to 16% decrease in PM 2.5 over Delhi NCR. So these kind of measures one need to replicate in other parts of the country in the context or in their local context, regional context, as it may be appropriate. So that is what I would say, that NCAP has provided a great impetus in these areas. Finally, what you have asked, that how realistic the target is, basically, of achieving mitigation in PM 2.5, which is the primary goal, overarching goal by 2024. I would say this is quite realistic and a little on the ambitious side. If you look into our neighbor China, they set a target of about cutting down 50% in 10 years. If you look from Beijing Olympic to 2018, in about 9 years, they could brought down PM 2.5 by about 50 to 55%. Looking at that, I believe a reduction of about 30% in 5 years is quite realistic. And what I also believe, that in the beginning, when we are transitioning to cleaner fuel, cleaner energy, where we have clearly identified some large polluting sectors, we can make greater strides. As we all know, and probably anybody who knows economics quite well, as things progress and as we already have adopted more cleaner fuel cleaner source of energy, then we would have to work harder to achieve further strides in that direction. So I believe that this is a very reasonable target, and the way momentum has been built on ground, next 2.5 years, I think we could definitely achieve it. Finally, you said that whether how sustainable or holistic the approach is, what NCAP is adopting. I would just say that the way I listed a couple of large missions, you see, most of them are also aiming at reducing carbon dioxide in a major way and other greenhouse gases. So probably the climate change is very high on the agenda of the current, government. Since both National Clean Air Program and all these large missions, whether you are shifting to solar or National Bio Mission, or there is now green hydrogen, all these are going to have large co-benefits. So that way, since the goals are quite aligned, I believe that National Clean Air Program would be quite sustainable in the near future. And we should see more progress as we go along. Thank you.
Thank you, Professor Tripathi. You made some very interesting points, and I think we share the optimism that you have in terms of the kind of likelihood of the cities able to achieve the stated targets that they have. Obviously, many of these policies and programs that you listed are going to be so critical, and how successfully we are able to implement them is going to make a huge difference. And I think one of the things that has been bothering a lot of people in the air quality space has been the shifting of the agenda as far as the adoption of the norms which were announced for the thermal power plants, and that's going to be very critical in achieving many of the stated targets if that also gets implemented as per plan. So thank you very much, and I'll come back to you with another questions a little later. I want to turn quickly to Iyad. Iyad, the second pillar that I was talking was more about the policy solutions that can informed by evidence. Now, C40 is working with cities around the world, and it's more than 40 cities. It's what, close to 100 cities now. So my question to you is that how is C40 contributing towards improving the evidence on ambient air quality levels across the cities program? And if you can, elaborate on the Breathe London model, which has a combination of hybrid air quality monitoring approach and ultra low emission zones, or from any of the cities that C40 works. And second part is, what are the good practices or interventions that several of the Indian cities can learn from C40 experience across the cities and the kind of action they've taken to implement at the city level? So yeah, over to you.
Thank you, Mr. Sinha. Thank you for having me at this really important event to discuss this important issue. So as you heard, I'm Iyad Kirbek. I direct an air quality program at the organization C40 Cities. And for those that don't know who we are, we're a network of mayors that are working together on climate action and creating healthier and more equitable cities. Our network, as you mentioned, is now 97 of the world's largest cities. So we account for about 25% of global GDP. And we have several cities in India as part of our network, including Delhi, Bangalore, Kolkata, Chennai, and Mumbai. And we're created and led by cities, so our work is driven by the needs of our member cities. We're governed by a steering committee of 17 mayors, and our chair is the mayor of Los Angeles, Mayor Eric Garcetti. And so what we found, air pollution is obviously a significant issue across most major cities around the world. We find 95% of the population of our C40 cities reside in areas that exceed the World Health Organization guidelines for PM 2.5. And strikingly, nearly a third of the population of our C40 cities reside in areas that exceed 5 times the World Health Organization guidelines, because we know that many of the largest cities and most populous cities are in parts of the world that tend to have some of the highest air pollution levels. But we also know this is a really incomplete picture, and I'm glad you spoke about the evidence needed to design well-designed policies. There's been recent estimates that have shown nearly half of countries don't have any PM 2.5 monitoring. And we know in many cities, monitoring is often quite inadequate, that there's not enough measurement happening to understand variation of air pollution within cities. And in many places, they're not conducting the right types of public health studies to really understand the health risks of air pollution. So we believe it within our network that this is an entirely solvable problem and that many solutions exist and have been proven to work in many parts of the world. And our work is really to try to build the political will and the broad-based support for investing in the right types of interventions, and then building the local capacity to improve air quality. So our work is really working at both the political and the technical level, where we work to support mayors in making commitments and advancing policies, while then working with city staff in the technical work to support air quality management activities. One example of this is we've been working with city halls to elevate air quality on mayoral political agendas through commitments. And so recently we announced a commitment, our Clean Air Cities Declaration, where 37 cities have committed towards working towards meeting World Health Organization guidelines and then implementing priority actions on air pollution by 2025 and increasing investment in air quality management, with really the goal is to create a city's movement towards clean air. And a lot of our work then is to develop urban scale solutions and best practice around air quality. We do this through collaboration and knowledge sharing, which we think is very important to increasing capacity for air quality management in cities. We have an air quality network that we actually launched in Bangalore 2 years ago, led by London and Bangalore, where we connect city staff to collaborate together on solutions around air quality, and then conduct a variety of pilot studies and projects in cities, while also placing C40 staff in city halls to advance air quality activities. For example, we've done work with the City of London to deploy a high-resolution air quality monitoring network called the London Hyperlocal Monitoring Network that combined fixed-site, low-cost sensor measurements at 100 locations throughout the city with mobile monitoring to understand variation in pollution levels within the city, and importantly, understand how the mayor's policies on air pollution, like an ultra-low emission zone that charges the most polluting vehicles from upon entering the city, how that has addressed air pollution in the city and lowered air pollution in the city, and then using that evidence then to support the mayor in expanding these types of policies. We have work in cities like Quezon City in the Philippines and Addis Ababa in Ethiopia to deploy sensor networks and reference air quality monitoring stations to start building the right type of data to understand what are the sources of pollution and how do they vary across different neighborhoods in the city, and then supporting these cities in developing their first air quality management plans. In Los Angeles, we've been working on both working with local community groups to deploy sensor networks and empower communities with data that then they can use to build community air quality action plans, as well as working on solutions to address local control on air pollution. So that includes working with, for example, the Port of Los Angeles to develop a variety of interventions around truck-related emissions, such as creating requirements for trucks that come into the Port of Los Angeles and ensuring that they meet clean air standards, and that then can affect truck-related emissions throughout the city. And then I'm glad you mentioned, the professor who spoke before me mentioned the importance of integration of air quality and climate action planning. We have a large effort within C40 to ensure that every C40 city has a climate action plan that's consistent with the Paris climate agreements. And we see that as an important opportunity to improve air quality within cities. And so we've worked on developing new air quality modeling approaches to allow cities to model air quality and public health benefits of greenhouse gas mitigation activities, and allow cities to then prioritize the right types of actions that can produce both climate benefit and air quality benefit. So I want to just quickly mention maybe some examples from a few cities that we work with on what have been some successful types of programs. You mentioned London, and London's a city that we work very closely with, that's invested a lot in ensuring air quality improvement. And what we see as really instrumental to some of London's successes is beginning with deep political engagement. The mayor of London has really made cleaning air pollution in London one of his political priorities and has placed some aggressive targets, including a target to meet the World Health Organization guidelines for air pollution by 2030, have the best air quality of any major world city by 2050, and a goal of zero emission London by 2050. And to support that, they've implemented world-leading data and analytics infrastructure, including the Breathe London study that I mentioned, high-resolution air quality monitoring. They have the London Atmospheric Inventory, which is a 1 kilometer spatial emissions inventory and modeling platform for developing and evaluating local policies. And then they have a lot of work that's used for community engagement to empower local communities with data and bring them along in the policymaking process. They also engage regularly with the research sector to evaluate the health risks of air pollution and communicate that to local communities, and then use this to build the broad political support needed to implement actions like the ultra-low emission zone that can often face opposition. And then continuing to work to support Londoners in meeting the targets of the ULEZ through things like vehicle scrappage schemes, as well as having a strong enforcement mechanism in place to ensure that, that the policy is successful. And this type of sort of data to action approach that we see in cities, we see in a lot of cities that have been successful in air quality improvement. And I wanted to just highlight another example in New York City, where we heard about some of the goals from the professor earlier of whether the NCAP targets are realistic. In New York City, we've seen nearly a 40% reduction in PM 2.5 levels over 10 years, really due to a combination of federal policy that has addressed large sources of pollution, such as power plants, and national ambient air quality standards that have been strengthened over time to address sources of pollution like power plants and shift off of coal to cleaner sources of energy. And then within the city has developed its own air quality monitoring networks to understand air pollution levels within the city and identify sources of pollution that are low-hanging fruit and are important for local policy. And one example is through local policies to phase out high sulfur heating oils within the city and shift to cleaner heating oils in the building sector. And that's resulted in a 97% reduction in SO2 levels over the 10-year period. And then the city is also now moving towards how do you completely eliminate fossil fuel use in buildings to meet climate action planning targets. And so the city recently set CO2 emissions targets for buildings, which will continue to move towards meeting the city's 2050 greenhouse gas mitigation goals. And we've estimated that when those are fully implemented, they'll produce over $1.5 billion in public health benefits to New York City through this greenhouse gas mitigation program. So I think really thinking about that linkage from how you collect the right type of data, identify the right types of sources, and then empower local communities and bring those communities along with you in developing those local policies have been really quite instrumental in places like New York and London. But I'll pause right there and maybe we can talk a little bit later about the specific types of policy interventions in other cities.
Thank you. Yeah, I think that's quite wonderful. And I think the key thing that you also mentioned was the deep political engagement and that buy-in of the political buy-in, and then that allows the right regulations, the right set of technical support, etc. And to the last point that you said, evidence and information that can empower communities themselves to put the right set, demand the right set of policy shifts or the changes, that makes a huge difference. And then that brings me very rightly to Bhushan, and which is on the point that I said earlier as a third pillar, which we focus on, is on societal pressure to build narratives and awareness across diverse set of stakeholders. So CB, I mean, want to raise two questions to you. As a growing think tank in the country, how is iForest contributing to build a narrative for adoption of sectoral policy solutions in cities that leads to systemic change instead of what cities adopt typically as band-aid solutions for clean air. And the second, in your view, the transitioning to long-term solutions require infrastructure readiness and also the investment that is needed. And NCAP basically has the provisions for both and the additional funding that is available through the separate programs that have been made available. So do you see that the state government and the city urban local bodies have the technical understanding as well as capacity to adopt and bring change as far as the clean air action plans are concerned? CB.
Thank you, Shirish, and I'm delighted to be here on this panel. Thank you for C-STEP for inviting me. Because the title of the session is Roadmap for Air Quality in Cities, I think it is important for me to point out that the roadmap for air quality in cities actually goes through rural areas, countryside, industrial estates, and mining areas. And I think that fundamental has to be understood very well. While I agree with Professor Tripathi on what NCAP has done so far, I think one of the fundamental drawback of NCAP is that it is only focusing on cities. And there are other programs, of course, which is focusing on rural areas like Ujjwala program, or for example, National Biomass Mission. But the issue that needs to be understood, Shirish, is that we face two, I think, intersectoral crises in India right now. One is air quality, climate, land, forest, and water crisis. And these are very interlinked crises that needs to be understood. 40%, most of the apportionment study, including those done by IIT Kanpur and many other institutions, are now clear that 40% of PM 2.5 or PM 10 are coming from natural sources, dust. So on one hand, and what are the sources of those dust? That has to be understood very well. The largest source of dust is 50% of our geographical area, which is becoming arid, desertified, and degraded. And that is also becoming arid, desertified, and degraded simply because our groundwater level is going down. Our rainfall is becoming uneven. So on one hand, we have air, climate, land, and forest and water crisis that has to be understood very clearly if we really want to reduce air pollution. On the other hand, we have air and climate crisis, which is linked to fossil fuel. And that both my panelists have very eloquently explained to you. In many ways, our energy basket is our climate basket and is our air pollution basket. We burn about 2 billion tons of material in this country every year. About 950 million tons of coal, about 500 to 600 million tons of biomass, about 100 million tons of oil, 50 million tons of gas, and then waste and other things. So you put them together, we burn about 2 billion tons of material in this country. Now, you really want to solve pollution, then start thinking about coal 950 million tons and biomass 600 million tons. 75% of what we burn, which is the most polluting fuel, which is the most important source of air pollution, which is also the biggest cause of climate crisis, is coal and biomass. And unless and until we address these two major sources of fuel, I don't think that we will ever be able to meet our ambient air quality norms. So it is quite clear to me that one, our action on land and forest fire is now becoming a significant source of air pollution seasonally, as is biomass burning from agricultural field. So those two are becoming important. Dust from agricultural land and wasteland is becoming a major source of air pollution across the country. And on the other hand, coal and biomass burning for industries, cooking fuel, thermal power plant is another source. So this integration issue is a problem in NCAP. And the state action plan, which is being developed, and we all are supporting the development of a state action plan. One of my focus and I4's focus is how do we bring these aspects into NCAP and start looking at issue of solid fuel, land, and other issues. That also has to be understood. And there are different departments that will work on it. So that's where we are looking at from I4S perspective. One, a national narrative which will reignite the understanding on these interlinkages and how different departments and ministries will work. Our second area of work is at state and city level, and that is your question number 3. I think we have focused too much on central government to deliver on anything on environment, okay, and command and control to deliver things on environment. I don't think both have worked. States and cities have very low capacity, and our regulatory mechanism of command and control has limitation in delivering. So on one hand, we will have to build capacity at the state and city level, and make sure that they are capable of delivering these issues. On the other hand, we have to change the tools itself. What tools a state has, other than saying that I'm going to close you down, I'm going to set a standard. We have a habit in this country of setting the most stringent standard and not meeting them. Okay. And I don't think that is required. We copy Western world all the time. And I think that's the biggest mistake we do. So New York has, for example, made Indian air quality standard, then so should Delhi. That's our approach. I'm sorry, that shouldn't be the approach. So, on one hand, build capacity of city and states on these interlinked issues. On the other hand, we also think that our regulatory tools will have to change. From command and control, we have to start looking at economic instrument, market-based instrument. Investment will become very important. The amount of money that is required cannot be paid by NCAP. Private sector investment will be required in all these fields. The maximum amount of investment that will be required is going to be private sector investment, including impact investments, and then of course public investment that will be invested in infrastructure and other areas. So overall, Shirish, I think, let me just repeat it again. The road for air quality in cities passes through villages, rural areas, industrial areas, and mining areas. Till the time we ignore this, we will not be able to solve our air pollution problem. Thank you.
Thank you, CB. And I always expected you to be thought-provoking. You're doing that exactly. So, no, I agree with you. I think there is a need for us to revisit some of our kind of frameworks that we believe are expected to deliver, but needs some change, especially the work around the regulatory command and control, and as well as the capacities that cities and states need to have. And I think that needs to really be looking at. Yeah, I just wanted to come back to you because of the point that CB raised on the capacities that cities do not have. I just wanted to understand, and if you could throw some light on, with C40 now working with several cities in India, and as you mentioned, Bangalore and London were the champion air quality cities. What is the strategy for C40s towards strengthening these capacities at the city level in India, and in the process, therefore, also improving their efforts towards air quality? And what are the challenges that you think India needs to prioritize to really achieve the ambient air quality standards, which I believe now India is revising its overall standards to become come closer. There are many options within the WHO standards, also the different benchmarks are there. So your thoughts on what you think you're doing in cities in India and what you think India needs to be doing.
Yeah, thank you very much. So, one of the things, and I think what we heard from Mr. Chandra was quite important, that we need to look at air pollution management in an airshed type approach. That while we work at a city level, we recognize that the actions that the cities can take on their own isn't going to be adequate to meet air quality goals. And that's true, I think, in India and in most cities that we work with. And so one of the key elements that we try to promote is coordination and collaboration, and recognizing that it requires this type of cooperation across multiple levels of governments and jurisdictions, including across regions. And so while the cities themselves have the power to influence and make investments on important sectors within their control, we need to make sure that the action plans, and we see this a lot in cities that we work with, where a successful action plan recognizes who's responsible for which sources of pollution and ensure that that responsibility isn't distributed and it's clear who takes which actions and have clear data behind them on how they're addressed. And you know, one of the examples we often use is Los Angeles, and I fully agree with Mr. Bhushan that actions and approaches need to be taken according to local context. But I do think there's things we can learn in terms of how collaboration across different levels of government can be useful in addressing local air quality. And we've seen this time and again in different places around the world where clear responsibility is assigned on different sources to different agencies, and then policy making is done collaboratively to ensure that those targets are met. In terms of some of the Indian cities, one of our early priorities is going to be around how do we scale local climate action. One of our initial efforts is going to be around working with cities to develop local climate action plans that are fit for purpose within those cities, and looking for opportunities where those local climate action plans can produce air quality benefits. We've shown this previously working with other cities that by prioritizing measures that address greenhouse gases and air pollution like VMT reduction and other types of activities that can be influenced by a city can produce some local air quality and public health benefits and can help meet local air quality goals. So as I mentioned, you know, we heard through a lot of this panel and previous speakers what's needed around air quality improvement in cities, and we've heard about you know, that there's a need for expansion of evidence, expansion of monitoring data, public health evidence, but also I think there's things that we can learn and apply on addressing specific sources. So we know, for example, the transport sector is growing in India, and vehicles on the road are expected to double by 2030. And so that's going to be an important challenge. And how do you invest in sustainable transit in these cities and address things like truck traffic in cities that are significant sources of PM 2.5 pollution. So whether it's looking at things like incentive programs to address truck traffic and replace trucks, or new regulation that sets targets for shifting and electrifying truck fleets. There's other examples, for example, you know, looking at things like policy instruments to addressing traffic within cities, like low emission zones and other efforts, as well as, you know, we heard the speaker earlier speak about what are some of the innovative strategies for getting private investment into air pollution improvement. So there's examples from around the world, like in Santa Monica, where there's been setups of how do you bring in electrification for freight in specific neighborhoods by engaging the businesses themselves and developing these partnerships within these areas as smaller pilots that then can be scaled to other locations. So I think ultimately part of our efforts and our goals are to really understand what are the most important sources that cities have influence over, and then understanding what are the mitigation strategies that have been proven to be effective in many places that can be applied under this local context.
Thanks so much, Ed, and for that. And what I was also going to do is, given the time that we have, combine my next question to Professor Tripathi, where I was actually asking him about, going to ask him about the role that National Knowledge Network is playing and what he sees as a plan and vision for that in his capacity as a coordinator for that NKN network. But there's also a question, interesting question for you, Professor Tripathi, in the chat, which is saying that at present, the way it appears that, you know, NCAP is very much focused on the ambient air quality monitoring of both PM 2.5 and PM 10. What are the planned initiative? I do remember from NCAP document there was something on indoor air quality, but if something is already being covered as part of the NCAP and NKN already, would be very useful if you could highlight on that.
Thanks. Sorry, last time I just missed out elaborating on the Mumbai experiment, so I would just take first half a minute to talk about that. So basically, this was supported by Maharashtra Pollution Control Board and Bloomberg Philanthropies. I am very thankful to both of them that this regulator in Maharashtra gave us all their government monitors. Basically, they gave us the sites to run this experiment for about 8 months in Mumbai. And we invited 4 top startups which are very active in this domain. And they deployed about 40 these sensors across these 15 monitors for starting in November last year, and this is still running at few sites. So we had actually access to about 40,000 hourly data, which is unprecedented. I have not heard of that anywhere, either in London or so. There are a couple of very interesting things that have come out and got some very positive reviews from some very domain-specific journals. So there are 2 important takeaways from this Mumbai experiment, which I want to highlight are, we saw that indigenously developed these sensors, I mean, the units sensors are of course imported as of now, could perform within an accuracy of 15% and with R square of as high as 0.85 to 0.9. And that is based on a very large data set cutting across different season, different meteorological conditions, and different aerosol environments in Mumbai. And the second important lesson from that is, based on some co-locations, we could develop models and we can use power of machine learning to adopt this model to different locations. So what we could do now is that we can reduce the co-location time to probably a day or 2, and then let the sensor learn from that data, and then we can actually apply the model to any place where you do not have any reference monitors available. So these are 2 very important outcomes, as it appears to me, having worked in the area of sensors for the last couple of years. And I think that could pave the way, as you have been mentioning, Mr. Sinha, for sensor-based or hybrid monitoring in the country. NKN was basically incepted in 2019, in the middle of 2019, but it got you can say refurbished late last year. And it has people or representatives from old IITs. Bhushan, of course, also is a member, a couple of people from top think tanks, and a couple of officials from the ministry, MOEFCC and CPCB, who are part of it. And it is given as a official status of advisory group to Central Pollution Control Board on all matters related to National Clean Air Program. What NKN has done since its new form in last about 7 months are basically, it has identified these institutes of repute across the country, which are about 95 technical institutes who have some capacity to work in the broadest area of air quality management, and we have been able to map them to these non-attainment cities. Idea is that we have a local capacity to provide dynamical feedback, as have been discussed by both my co-panelists in the city action plan and for many other needs. NKN also has been very helpful, and it assisted Central Pollution Control Board in formulating a very detailed protocol, which that states and cities would use to evaluate the progress of their action plan, and that also would help in third-party assessment. So some of these IORs, as the MOEFCC would decide, would take these people from IORs, either technical persons, scientists, or professors, to do the third-party evaluation. Currently, we are also engaged in evaluating their state action plan, and there is a lot of discussion going on in NKN, and hopefully we'd also have more discussion not only with the State Pollution Control Board, but the state functionaries themselves, and we'll have some idea about how we can give them some concrete inputs on revising or building the new state action plan. We are also working on a very ambitious, and Chandrabhushan also is a part of that, developing a training program in the short term and a training system in long term, and that is going to be supported by an international agency and under TA, and of course ministry also will be part of that, and hopefully we are going to start that very soon, and this would be linked with the National Skill Development Council. So in some way it would also basically lead to some generation of you can say green jobs, etc. And in addition to giving or building capacity and providing skills across starting from the boards and to IORs, etc., and of course city officials. And finally, NKN also have provided a very good you can say a support in developing a nationwide emission inventory in partnership with certain IORs, and then also a couple of very well established non-profit agencies. So these are 4 or 5 important accomplishments where which NKN either has accomplished by now or very much working in that direction. That's what I would stop it here.
Thank you, Professor Tripathi, for that. And I just wanted to kind of, I know I'm being very poor with the time management this time. So CB, there is a very direct question for you, and I think also could be your closing remark, and then I'll go to Iyad and Professor Tripathi again for a very short 30 seconds response. The question is that you talked about capacity building, the need to be built across cities and states. So what, if you could say 3 things that the state and city authorities needs to do to build their capacity. So if you could just 30 seconds, top 3 level, which is your direction of what the way forward should look like for us.
So Sirish, I think Professor Tripathi has answered that question, that so far training and capacity building in this country was about technical knowledge transfer. But the fact is technical knowledge transfer doesn't get converted into action. So we keep doing large number of training programs for everyone, and then the same person can come back to you after 4 years to do the same training program. Okay. So any capacity building program has to be linked to skill and knowledge together. And that is what our entire focus in NKN is. And that's where National Skill Qualification Framework is a very robust framework. And we are trying to convert training programs under NKN, and these will be open libraries. So our effort also under NKN is that once a training program has been done, it has been certified by National Skill Development Council, it can go into a national library. Anyone who wants to do that training program and qualify for that will get a certificate as maybe level 4 air pollution expert. So there are different levels through which you can certify people. So basically, we must start thinking about training and capacity building program from skill and knowledge together, not only from technical knowledge transfer. Number 2, there must be incentive for people for doing those training programs, because there will be examination at the end of the training program for one to qualify as a air pollution expert. So it must be linked to job. And number 3, there must be support for doing this, because a lot of people cannot afford to do these. These will be quite expensive training programs. So we are also thinking about putting in place resources from various places, so that everyone who is interested, from city, IOR, State Pollution Control Board, NGOs, experts, can also go through these training programs.
Great. Thanks, CB. Thank you so much for that. Iyad, quick thoughts. What would be your couple of recommendations? What cities should be doing as way forward?
Yeah, so I think there's a lot of training that happens at the technical level, but I think really thinking about the connection of that technical level training to the social aspects of air pollution management, and connecting to communication and building the political will, which is a different type of skill set that often we see happening in cities that are successful in addressing air pollution. How do you take that technical knowledge and move it towards creating the sustained action needed around air quality? The second piece is really around, I think, governance. Once you know the important sources of air pollution, how do you then structure air quality management according to the local context to ensure that the policies that are put in place can create that type of sustained change? And then the last one I'll mention is really the thinking about the intersectoral nature of air quality policy. How can you design air pollution policy that's meeting multiple goals within the city, such as reducing GHGs and for climate action, as well as addressing non-communicable diseases through actions that are improving public health more generally. And then that can create more sustained and more effective policy that can be supported more broadly throughout the public. That's really what I see as being an important element of moving forward.
Great. Thank you so much, Iyad. Professor Tripathi, your closing remarks, few suggestions you think we should be focusing more on?
I think just as a follow-up on actions for cities, I would also just say that we have given enough resources as a part of those, 15th Finance Commission and NCAP. Now cities need to generate their, or augment some resources from their side, like mayors, and they should partner with local industries to increase or scale the monitoring. It could be hybrid monitoring, or they could add CA/QMS. That's, I think, city level monitoring is quite important. There's a great disparity. You look at NCR, we have 40 monitors, Mumbai, Bangalore, maybe a dozen or half, but look at Kanpur, maybe 1 or 2. So that's the first thing. Now, cities need to have a trained, reasonably trained air quality person as a part of their governance, which I think many cities don't have. Generally, traditionally, they have a sanitary inspector or maybe somebody who's trained in water or wastewater kind of thing. Now the cities, every city, non-attendant city, need to hire somebody who either or certainly should have a master's at least in air quality management. And third, I think we are talking about airshed approach, etc., which is definitely quite important. But I was looking into Lucknow, just out of interest, we are putting a network there, and 65% of the pollution load in Lucknow is generated within the boundary of Lucknow city. So, and out of that, a great chunk is from industries, and in that, brick kiln are an important source. So, if you have these large sensor network, maybe out of 60 to 100, which is there in a city like Lucknow, and you target a couple of these point sources, right? Because there are other interventions which will be made at the state level or at the national level, as was pointed out by Mr. Ayed before in your city. But cities could identify and then can make more focused and concerted effort to reduce mitigations from these in a very timely fashion. And that's where we need to, work. That's where what I would think are the priority items from my side.
Great, thank you, Professor Tripathi. And I completely agree with you. And I think, as you are aware, some of the work that has happened based on the work that you did and your team did in Jaipur, and our partners are now working with the Jaipur Municipal Corporation to clearly identify those critical hotspots within the city and plans for them. And I think the hotspot mapping was already prepared by your team. And I think the same thing is happening in Gurgaon through the pilot project that we are supporting, that is really looking at augmenting the capacities within the municipal corporation and the GMDA in this case, which has resources to augment its air quality monitoring, but it needs technical experts to kind of manage the entire air quality management. It's great. Thank you so much, Professor Tripathi, Iyad, and Chandrabhushan, for your interesting session inputs. I think it made a very lively discussion. My apologies, I couldn't take all the questions. Since the response of the panelists were so interesting, I couldn't go to all the questions, but I think some of the questions that were there would have been addressed in the second round of response that the panelists provided. So once again, thank you so much for your time. Very valuable. I've taken notes. Pratima, I'll forward them to you as I was typing, and I'm sure you and your team has done the same. So over to you, Pratima. Thank you once again, everyone. Thank you so much.
Thank you.
Thank you, Shirish. Thank you, Shirish, for chairing the session. That was really interesting conversation that we had. Thank you, Professor Tripathi, Mr. Iyad, and Mr. Chandrabhushan. And really interesting discussion around the capacity building not only for the government official, but for the community as well. And yes, till date, we have been focusing on knowledge transfer, which we haven't seen converting into action on ground. So that is really interesting. And I hope as an IOR and other institutes with which we are working, we will also try to focus on that aspect going forward. Governance, yes, governance is another challenge that we have been observing with the cities and states that we are working, and I'm sure we will have to initiate some dialogue on the structure, how this challenge needs to be addressed going forward, because there are multiple departments who are working, under the guidance of Urban Development Department for the NCARE program, and there's a lot of coordination challenges still we see. So probably we will have to have a separate discussion on how to address the governance challenge. So yes, thank you so much for the interesting conversation and the insights. Thank you for being at ICAS 2021.
Thank you.
Thank you, Pratima. Thank you.
Thank you.
Bye-bye.
Bye. With those interesting insights and thoughtful points for us to ponder on in the coming days and months, now I invite our Executive Director, Dr. Jay Asundi, to close the session with way forward points. Over to you, Jay.
Good evening. Can you hear me?
Can hear you but can't see you.
Okay, just let me make sure. I should have. Let me try this again. Okay, there we go. Is this better now? Can you hear me now? Yes. Okay, great. So good evening, and I think it has been a fantastic 2 days. It's not the end, and so I obviously stand between you and a fantastic training session on low-cost sensors with Michael Giordano as well as Ronak Sataria. So I'll try to be fairly brief, and I'll also try to put together some thoughts that I had as I listened to the various speakers across the day, across this afternoon. And we did have a very good set of speakers who essentially gave us a sense of one is, what does it take to produce good air quality? When we started off, we had Sri Brijesh Kumar, the Principal Secretary, telling us about the fact that it is a wake-up call for us in India, and that we do need local solutions. I think that was very important to hear. And so from our going forward perspective, I think we definitely need to continue our role of strengthening data, strengthening monitoring. And he did put in the aspect that we need to start also looking at the issues of indoor air pollution. And I do see that being important because it affects a lot of women and children in the country, and that is something that we need to really be concerned about and worry about. And so I think that is something that we need to really take forward with ourselves. One is how do we generate the local data that we need, produce the solutions in those local areas. Obviously, we cannot blindly follow the methods, or not from the measurement point of view, but from the implementation point of view. The interventions that we need to have need to be more local, more well understood, and that we also need to expand our scope of understanding air quality, which has always been about ambient air quality, to also now start worrying about indoor air quality. In the next session, which of course dovetailed really nicely on the indoor air pollution, we did see a number from Dr. Kalpana, Dr. Bhargav, Dr. Pallavi, and also Mr. Bhushan, essentially coming up, and actually the statement that really stood out to me during that session was what Dr. Kalpana left us with, which is if we want more evidence-based practice, we need more practice-based evidence. So I think we need to think about ways in which we can measure our indoor air quality better. Yes, it would lead to more diseases being attributable to air quality, air pollution, but I think it's something that we need to work on, and I think it's definitely a way forward. That also brought in the whole idea of the Pradhan Mantri Urja Yojana, which is more about trying to provide better energy access, and that's the clean energy access. And of course, Dr. Pant raising the point that we need to go beyond PM 2.5 and also look at other individual air pollutants. And I think that's really important right now, given that beyond, of course, the PM, you'll also have to think about the VOCs and other pollutants that could affect our health. On the issue of occupational health exposure, we did have a whole number of people talking about occupational hazards that can be prevented through air quality. And a lot of it is also, we saw Dr. Nagpuri talking about the root cause of disparity through waste burning. And you'll see that better waste collection will lead to cleaner air. And I think that needs to be conveyed to all people across the board. Of course, Professor Vig also raising the point that it's not just the farmer, because that's a convenient excuse. And I think we need to find a way in which the biomass from agricultural waste is collected and taken forward. Finally, in the session that was just concluding, which again, very rich conversation between Professor Tripathi, Iyad, and Chandrabhushan, very well organized by Shirish, on how do we build the evidence, how do we build the training programs that came up. And again, I think that local evidence, local communities, using local communities came up again and again. And I think the important message that I took away from this particular session is that we need our technical knowledge to be translated into action. And this will need more than just training programs. We need to figure out a way in which skill and knowledge can be brought together and have these certifications, of course, bring in people with certain kinds of qualifications so that the knowledge is maintained and kept throughout. So while you may say I have just summarized what has happened during the day, the point that I would like to then think about going forward, and this is of course not just to my team here at C-STEP, but also across the board, is this idea of finding local solutions. That is number one. Let's try to create a compendium of local solutions that will help improve air quality. Of course, we do have this urge to copy what we see elsewhere, but I think we should try to fight that urge. Of course, understand what is happening in other places, see whether it is relevant to your respective local areas, and move in that forward. That is number one. Number two, indoor air quality. That is something that we really need to start worrying about, thinking about, and caring about. And the third I would want to put is in this broader perspective that quality of life will improve in India if we improve air quality, for sure. But air quality is not a sector by itself. It is connected to the broader economy. And I think we need to think about how we need to have this clean energy transition. I think now we are getting into the aspects of climate change, looking at how we need to get away from carbonaceous based fuels to other types of energy that are cleaner and that will provide for cleaner air and a cleaner life for all our people. So I think from that perspective, I think we need to now see how we can dovetail our climate mitigation and maybe an adaptation efforts to improving the quality of life of our people, as in terms of also dealing with issues related to climate change, but also thinking about the co-benefits that it will lead to from our health perspective. What do we need to do from a climate perspective that will also improve our air and improve air quality? So I guess with those three very broad areas in terms of what is it that we need to do working forward, I think it goes without saying that we need to continue to support our existing programs like the National Clean Air Program, the various other programs that we have in terms of providing clean energy, energy for all. All these are important programs, but I think the overarching issue that needs to be concerned is how do we take advantage of these co-benefits from climate change to clean air and effectively provide clean air and a healthy life for all. So with those very few statements, I will leave you in the hands of the capable team with Pratima, and I will of course continue to listen to how we can use low-cost sensors for our measuring our cleaner air. So thank you all, and thank you all the participants. I really feel sad that this is the time when we would be gathering for a coffee and discussing networking, and the part that I mentioned when I opened the entire summit was that this is the area of networking. Hopefully we will be able to network still, but I do hope that you will think that you took away something from this and look forward to the next ICAS where we will physically probably be able to meet each other and discuss some of these issues as we go forward. So thank you again.
Thank you, Jay. Thank you for summarizing and putting the way forward. And thank you for the motivation on networking, even on the virtual platform. We'll definitely, continue doing that in the coming time. Without a further ado, I would want to start our expert class. So today for our expert class, we have how do we monitor and use low-cost sensor monitors. So we have Dr. Michael Giordano, Executive Director of Free Air, with us today. Free Air is an organization dedicated to improving air quality in Africa through infrastructure development, capacity building, and open access data. Dr. Mike research includes aerosol cloud interactions, emission characterization for vehicles and large ships, source apportionment, emission studies, and ambient measurements of various polluting sources in Nepal, and performance and calibration of low-cost sensors. So I would invite Dr. Michael to please carry out the expert session on low-cost sensors. Over to you, Dr. Michael.
Yeah, thank you, Pratima, for the introduction. Again, my name is Mike Giordano. I'm the Executive Director for AfriCare. AfriCare is an organization dedicated towards many of the same things that we're talking about here. It's capacity building and infrastructure development, mostly centered around Africa. But a number of the take-home points are, of course, applicable to the rest of the world. And I can go ahead and share my screen if I can be given that access.
Yes, we have provided you the keyboard access. You can change the slides at your end.
Please share my screen. Is it currently showing my PowerPoint?
Yes, we are able to see your screen.
Okay, great. Dr. Subramanian, I work with very closely, may be in the attendees list right now, but if not, he's...
Yes, I invite Dr. Subbu also. I see he is in the panelist session. So, yes, Dr. Subbu, please feel free to provide your inputs and then comments whenever you feel.
Yeah, so low-cost air quality monitoring, specifically talking about using, calibrating, and ensuring that you have high-quality data from low-cost sensors in particular. I'm not going to spend too much time on this. I think everyone knows why low-cost sensors are important, right? Traditional reference monitors are very expensive, and in many places of the world we have very high PM levels, but very low coverage of monitors. And this is where low-cost sensors really shine, is that they can step in and get that spatiotemporal monitoring that we don't have in most of the world. So I'm going to break this up into 3 sections. The first will just be a quick overview of low-cost sensor design and the principles of operation and what they're sensitive to. And this is all from a recent paper that we published, Giuliano et al. In the Journal of Aerosol Science. The DOI is there. I can probably link this in a chat after I'm done. And then after that, we'll talk about some of the other limitations and the linearity and the limited detection parts of low-cost sensors, and then finally talking about how you actually calibrate them and what methods we can use to make sure that we get high-quality data. So low-cost sensors, right? There's particle sensors and there's gas sensors. We'll talk first about the particle sensors. The majority of low-cost particle sensors are going to be operating based on light particle interactions described by mean theory, right? So you have a particle, you have some light, and it's either absorbed or scattered or thermally radiated. And mostly what we're measuring here is the scattered light, right? So how much light does a particle scatter away? And this is done generally just in this very simple way. We have a light source, we have a photodiode, we might have some focusing lenses on one or both of those pieces of instrumentation. You have a flow chamber through which that light is being shown, and the particles go through it, right? And so when the particles interact with the light, some of it's scattered. If you have some idea of how much light is scattered by a certain type of particle at a certain size, and all these fun things that described by mean theory, you can get a signal in your photodiode, and you can then basically say this is how much PM mass there is, right? And you know, in actuality, these low-cost sensors are very simple. Again, you have some light, some laser, maybe an LED. It goes through this cavity, and then you just have some little circuitry on the end, right? You take the signal from the photodiode, you amplify it, and maybe or maybe you don't have a microprocessor on board as well to give you some certain other informations other than just a digital or an analog signal by itself. These are just a couple of relatively common, easily available low-cost PM sensors. This is the Plantower PMS503. On the left and at the bottom left, you can just see the diagram of how it looks. Again, so you have the particles come in, they flow out because of a fan. There's a laser, there's a photodiode, you're measuring the scattering. And then on the right, we have the same. Sorry, don't know if that shifted me. That's a Shinye PPD 42NS, and doing much the same, right? Just a slightly different orientation and no fan. There's a resistor to move there. This is a table straight from that paper that I was talking about. The basic takeaway here is there's a lot of different low-cost sensors, different makes, different models, different wavelengths of light, different angles of scattering that they're measuring, whether or not they're aspirated, do they have a fan, do they not have a fan, how much is that pulling, and those things, they all affect things like stated lower size sensitivity and of course their price, right? So the more complex ones that have more complex outputs, have that microprocessor on them, are going to be a little bit more expensive. So that's one side, right? I won't spend too much time on this because we really haven't talked too much about gases, and there's been mostly PM focused in this this whole day and this whole 2 days. But there are also low-cost gas sensors basically they work by making an electrochemical reaction based on gas diffusion through a membrane. And you're measuring the voltage differential, and you're trying to get the gas concentration from that voltage differential. Okay, so that's how they work, right? Back to particles. Because what we are doing, right, is using me theory to essentially try and measure particles. Anything that changes the refractive index of a particle is going to be a sensitivity for these low-cost sensors, right? And so that includes things like the shape of the particle, right? Do we have a sphere, or do we have something that looks like soot, right? Something that's like this weird fractal agglomeration. The size of the particle is also very important, right? Of course, the manufacturers, they calibrate their sensors beforehand. But if your size distribution is very different from the one that the manufacturer used to calibrate, you're going to be measuring a very different amount of PM than what the sensor tells you. The composition, what the particles are made of, again, the manufacturers and other people will test PM, low-cost PM sensors using a certain type of aerosol, right? A certain type of particulate matter, whether it's like something like Arizona test dust, or ammonium sulfates, or ammonium nitrates, or just anything of this, right? Again, if what you're measuring in the real world is different from what it was calibrated against, you're going to get a different answer for how much PM is actually there. All right, these are all things that affect me theory because they're changing the refractive index, and of course water content, right? This is not even talking about the fact that most regulatory measures for PM specify dry PM mass, and which means that if we're using a low-cost sensor, we're almost inherently measuring some water content with it. You know, how do we make sure that we can translate those two things and they're not so far apart from each other? Again, meteorological conditions, temperature and RH, that plays into the water content. The particle concentration, how many particles do we have? Are we overloading the sensors? Or are we just not getting enough particles through to even get any signal at all? Right, all these things are sensitivities for these low-cost sensors, and we have to be aware of them, and we have to think about how our actual deployments of these sensors will affect the answers, the data that we're getting. All right, this is just an example of how some of these sensors are sensitive to some of these things, right? So on the left, there's 3 different sensors. These are from China et al. In the Journal of Aerosol Science. On the left, we have the low-cost sensor signal versus TOM, which is a reference monitor signal. The mass measured PM2.5, the ratio of those two compared to relative humidity, right? So at higher relative humidities, really anything above 50%, these 3 sensors that China measured in this paper are going to give you more reported PM2.5 than what's actually there, right? And this can be significantly more. This can be almost twice as much, right? So you can't just take the output and trust it inherently, right? And on the left, this is just, again, how are these sensors sensitive to the composition, right? So again, ammonium sulfate, test dust, et cetera, you can see that the low-cost sensor is giving a different answer than what our reference monitor and what we generally think of as, you know, actual real PM2.5 is. The gas sensors, again, I'm just going to skip over this, but the story is really the same. There's real sensitivities to temperature and RH, and there's selectivity issues with gas sensors as well. You know, your low-cost gas sensor may say it's measuring ozone, but maybe it's also measuring some other things, and you can't really differentiate that. And so, how do you get around that? It's a different story. That's level 1, section 1, right? How are these sensors made? What are they doing? What are they sensitive to? But also inherent in this is we need to talk about some aspects of any instrumentation, right? So linearity and limits of detection. All right, so linearity, this is the response of a sensor across its range, right? So all these little graphs, you can have the sensor response versus the reference response, right? So the reference would be like the true measurement, the real measurement, and then versus what we are, what we think we're seeing, right? So ideally, right, we want a sensor that responds exactly the same as a reference measurement, right? It's a linear line. It's one-to-one in the best ideal world, but it doesn't have to be, right? But this is sometimes you'll get low-cost sensors that do this, and sometimes you won't, right? Sometimes you'll get curved sensor responses or these weird monotonic responses, and dealing with this is one thing, but I want to stress that you need to know how your sensor is responding, right? And this is one of those things where you really need to, before you put your low-cost sensor out anywhere, you need to figure out a way to test for this, right? And generally speaking, the way you do this is you just set it up next to a reference grade monitor or a lab grade monitor, something like this, for a while before you go send it to where you want it to. We'll talk about that later. But if you don't know, if you don't have an idea of what your sensor linearity looks like, it makes everything else that we're going to talk about questionable, right? It's hard to really say that the calibrations that you'll make for it are good calibrations if you don't have a good idea of what the linearity is. Right, so like there's this takeaway, right? We need to periodically ask, and we need to, especially at the beginning, ask, do new sensors have a linear response? Over what range is this response linear? And there's also this question of the lifetime of the deployment of a sensor, and how does linearity and sensor response change over that lifetime? I'll say right now, for a lot of low-cost PM sensors, a lot of work has shown that they generally are not sensitive. They're never not sensitive to lifetime and deployment history, but in many places they're not. But for gas sensors, this is absolutely not the case, and they are very sensitive to lifetime and deployment history. And right, so there's more about linearity. I've actually given this talk before, and this is going to very quickly be uploaded to the AfricAir YouTube channel. So if you ever want to go back and see a slightly longer version of this talk, I'm happy to give that, or I'm happy to have you go to YouTube, search for AfricAir, AFRIQAIR, and go watch this talk there. Because I'm not going to spend too much time on this, right? Here's some real examples of sensor linearity from a couple of papers. So before you get a new sensor, test linearity, you should also have a really good idea of what your limit of detection is, right? So how few particles can you measure reliably, and how many particles, or how much PM 2.5, generally speaking, can you measure reliably, right? This is the lower and the upper limits of detection, right? Again, you need to have an idea of what they are, because it impacts what range of conditions you can actually deploy these sensors in, right? If you're trying to measure 2 micrograms of PM 2.5, but the low-cost sensor that you're using only reliably reports 5 and more, that's not going to work, right? And on the flip side, it's the same thing. There are many places in the world where more than 100 micrograms, 200 micrograms even, isn't unheard of. Some of these sensors may not reliably report above that or at those levels, right? And they're just going to top out, and there's going to be no more response for increasing levels of PM. And so you need to know, and you need to have an idea of what these limits of detection are. Sorry, I'm rushing through this, but I'm trying to keep us on time here. Okay, so that is how these low-cost sensors are designed and how they operate and what they're sensitive to, as well as these two ideas of linearity and limits of detection, which you need to have an idea of before you put your sensors out anywhere, right? Before you go and deploy them, and before you make your 10, 100, 50, 200 node network, right? If you don't have an idea of the linearity and the LOD, it's not going to work well. But also related to this, right, is you also need to just correct the overall signal response, right? So linearity and limits of detection are how does the response differ over a range, or how does the sensor react over a range of responses? But there's absolutely no guarantee that your sensor is going to be responding in a one-to-one as compared to a reference monitor, right? So we need to start making some way to calibrate these low-cost sensors, and this is already mentioned in the previous talk a little bit about using machine learning, and I'll give a slightly different what Afric Air's ideal way to calibrate is. This is not the be all end all, but this is how we would go about it and how we would recommend people do it and how we do it in Africa. Right, so we need a calibration model, right, that connects a low-cost sensor for all these different sensitivities we're talking about, right? The shape, the concentrations, the size, the RH, temperature, et cetera, et cetera. And so how we do this, right, is we compare our low-cost sensor to some reference method, right? This is, generally speaking, what we're going to do is we're going to put them in the same place. This is going to be a co-location measurement. And we're going to use some high quality measurement of, if we're using PM 2.5 low cost sensors, we're going to get a high quality PM 2.5 measurement. This is going to be a TOM, a BAM, et cetera, et cetera. There's many options out there. But what we want to do is, you can see this from this little graph, we want to take the reference measurement, which I have here in blue, take the raw low-cost sensor signal, which is here in black, and then somehow correct that black signal to be on the blue line, right? Which I've shown here as a red line. So again, Africa, very big proponents of the co-location calibration. There are other ways to calibrate. I'm not going to talk about them because, in our view, co-location is the way to do it. Basically, again, you're going to have your low-cost sensors and your reference monitors in the same place at the same time, measuring the same pollution or the same air, right? You're going to want to measure for long enough that you get the entire range of conditions that you would expect where and when you're going to deploy your monitors. So a good example for India and for a lot of Africa is if you have a co-location calibration set up with a reference monitor and a couple low-cost sensors, but you're only measuring during the rainy season, you cannot take that calibration that comes out of that co-location and apply it to a not rainy season. You cannot apply it to the dry season, to the biomass burning season, to any of these other times of the year, right? Because you didn't measure the entire range of meteorological and other conditions that your low-cost sensor will see when it gets to be where it's going to live for the rest of its life, right? And so we need to be careful about this, right? So this can be difficult, right, to do in just one shot. And maybe your specific use of a low-cost sensor isn't to do intensive year-long measurements. Maybe you don't need that whole year-long co-location. Maybe you need to do like a couple of 4 weeks here, 4 weeks there, 4 weeks there during the year, and that can be used that can be good enough for you. Right, this is one of those things where you have to think about how you can capture all of the conditions that you expect, right? And again, Depending on your reference method, this can also change the length of deployment that you need. So things to consider when you're doing this, right? How long does it need to be, right? How are we going to get all the expected conditions? I beat this into the ground, but I'm going to say it again. Do we need, if we have multiple low-cost sensors, how many do we actually need to put in our co-location calibration, right? Are they all similar? Are they all reacting in the same way when we do our linearity tests? And if we just plot them versus each other, do they agree well? Do they sit on a one-to-one line? If they do, then maybe we only need to take a couple of our sensors, right? If we have 100 sensors, maybe we don't want to put 100 with our reference monitor. And we can just take a few if they all agree with each other. You know, again, how are we going to get all these conditions? Can we do it in multiple steps? Can we break it down by season for a couple weeks in the rainy, a couple weeks in the dry season? Or is that going to make things harder for us? And again, you know, can we move our reference monitor, or is it fixed? For the most part, for the vast majority of people, it is very fixed. It is very difficult to move. And you know, that means that's going to change how your co-location and your calibration is going to work, right? And you just need to think about it. You need to think about it before you do it. And you know, again, as long as you make some effort to capture everything that you can, the data that comes out of your low-cost sensors is going to be so much better for it. So the more work you put in now, the more high-quality data you're going to get out later. Okay, so that's like how you do it, right? But the next step is, okay, so you have this data from your low-cost sensor, and you have this data from your reference monitor. You know, how do you make a model out of those two things? The answers are pretty simple. There's either some simple regressions that you can run, like linear and quadratic regressions, or you can go more complex, right? And you can start using machine learning and Gaussian processes and K-means clustering, neural networks, random forest, and all these fun tools. Of course, there's a difference between these two, right? The linear and quadratic models, you can do these in Excel or in very simple programs. Africa actually has a program that's about to go up on my personal GitHub for doing linear calibrations of low-cost sensors and reference data. But right, if you're going to start moving into the more complex, then you need some coding expertise in R and Python. And I will say in India, this is a lot more common than it is in Africa. But again, it's something to keep in mind. And you know, if you're going to use a certain method, you know, please just be open and tell people what you did and how you did it, so that they can reproduce it. Right? Open science is really the name of the game, and as long as we're open about how we did things and how we get our numbers, we can at least have some confidence that these low-cost sensors are getting high-quality data, right? There's also some other hygroscopic corrections for low-cost PM sensors. I would refer you to a paper by Mailings et al. You can Subu might throw that link in the chat, but I'm not going to talk about them here. Okay, so simple models, right? Linear model, y is equal to mx plus all the other variables that you might use, or the quadratic model, right? There's you take the quads for all those things. And right, the question here is what do you use? What input variables do you use, right? If we take our reference data is our y, right? Then we would assume that part of our input is going to be our low-cost sensor signal, right? And the question is, what else is there? And the answer here is the ones that we have, A, and B, the ones that we have that are justifiable. And so what I mean by justifiable, I will refer you to another paper. This is Hagler et al. 2018 from Environmental Science and Technology. And this is talking about low-cost sensors and how the parameters that we put into our calibration models may or may not be appropriate, right? And so we have defensible parameters, things like relative humidity and temperature, and if you're using gas sensors, maybe some cross-sensitivity gases, as well as, right, there's a whole list of things. And then there's questionable parameters, right? Things that we should not be putting inside of our calibration models. You know, things that have no direct relation to the physics of how your sensor is working, right? Not the physics or the chemistry of what your sensor is measuring, right? That is a very different thing than how your sensor works, right? So what I mean by that is, okay, things like wind speed or direction or like the time of day or day of week will have some inherent information about maybe the different sources that you're getting, right? If you're going to put time of day into your model, that's probably going to sort of implicitly account for things like cooking, but this is not a defensible way to make your model, right? This is not a robust or a necessarily well-performing model outside of the time that you have data for your co-location, right? This is the problem. If you start using all these other variables that are not related to your the physics of how you're measuring something, you have no confidence that those other variables will still give you a reasonable answer once the reference monitor is taken away. You cannot say that your calibration model will work outside of when you took that data. And again, I'll refer you to this paper to read more in depth of this, but I just want to be real clear about that. So for PM sensors, generally the most common way to do this is with just a linear model, and basically you solve your reference data is equal to your PM from your low-cost sensor times some coefficient plus the temperature times the coefficient plus the RH times the coefficient, et cetera, right? Because these temperature and RH are defensible parameters, right? They relate to the physics of how your low-cost sensor works. And there are other variables that we can choose, right? Just again, make sure that they're defensible variables. And so, right, you can generalize that out into quadratic models, or if you're doing machine learning, right, the answer is still the same. You shouldn't be using non-defensible variables inside your model. I think I'm somewhat running up on the time here, so I'm not going to go too much longer than this. I will also say that, you know, in choosing those variables, you can check and make sure that the variables that you've chosen will work outside of your outside of the time that you have co-location data for, by doing something like a k-folds cross-validation, right? And using training and testing sets. And I'm not going to go too far into this. I recommend you go look at the paper for exactly how we do this. And again, there's some very simple examples of that, but I'm not going to go too much. Okay, so how you get the data for a calibration model, what model you should choose, and then, right, once we have a model made, we should also have some idea of how well our model performs, right? And so there's a couple things that we need to be reporting here. A bias, right? We need to know if there is like some systemic offset from the reference data in our low-cost sensor, right? Is our low-cost sensor always going to be measuring 5 micrograms more? The correlation, right? So how good does the model, does our calibration model work, and how well does it compare to reference data? As well as the precision, right? We need some idea of precision, whether or not we're using normalized values or not normalized values. I talk a little bit about this in this paper about the benefits and the drawbacks of using MAE and RMSE and et cetera, et cetera. But again, in the interest of time, I won't do this too much. You know, Africa really likes using these three things: the mean normalized bias, the Pearson R, and a bias corrected coefficient of variation of the mean absolute error, the CVMAE. And this is the way that we look at things usually. If we plot the CVMAE as the Y and the R flipped as an X, then we would want, we can make a model, right? We can measure the performance of that model. We can do that a number of different times, a number of different models. And then we would want things to be in this bottom left corner, very low CVMAE, which implies a high precision, high accuracy, and very high R, implying a high correlation, right? And again, right, this is just some examples of how we can look at this, and we have multiple models and we can compare them, and then once we've compared them, we can pick the best model that works for us. We can do this for gases as well as for data for PM. And so I will try and wrap up here and just say, you know, there's a lot of different ways that you can use low-cost sensors. You can do ambient measurements outside. You can do indoors measurements. There was a lot of great talk about exposure and you know how it's a good thought exercise to think about how you would use a low-cost sensor in those sorts of applications and seeing what attainment you're getting. We just make sure that we have, you know, yeah, and again, I think I went through a bit quickly about how to get this high quality data, but again, I would refer you to, I know this session is being recorded. Again, you can go back and watch this, or you can go to the Africair YouTube channel, which by tomorrow should have a longer version of this talk uploaded. And again, you know, just be open and tell people what you did and how you did it, and make sure it can be reproduced. Because if you don't do that, it makes people question, you know, why are we using these low-cost sensors if you can't tell people what's really there. And so with that, I will end, and I will stop sharing screen.
Thank you, Dr. Mike, for that amazing presentation and clearing most of our basic challenges. Dr. Mike, are you there with us?
Yes, still here.
Okay, perfect. I lost your video. Yeah, so thank you for clearing so many basic concepts, and I'm sure our attendees would have definitely learned a lot from there. I'm just going to pose two questions quickly, and we will, you know, collate all the questions and send it to you later. So the first question: what is the ideal? One second. Yep. Yeah. What is the ideal operating condition, temperature and humidity for electrochemical sensors? First question. And the second question is, can you please help with what softwares do we need to visualize the large chunk of data which comes out of low-cost sensors? Softwares which are used to make maps, for example, in your presentation, you had mentioned in 2021 paper that you published.
Yeah, so the first one, electrochemical sensors. That's a tough question. Depends on which sensor you're using. I would have to look this up. I would go back into the papers that I pulled figures from my talk here. And try and go to those papers and look it up. Off the top of my head, I do not know. I must confess. And the second question: what softwares do we need? If we're not going to do any really complex machine learning things or anything like that. Excel or OpenOffice, if you want the free version, or even Google Sheets can get you where you need to be, right? You can do things like linear calibrations with those tools. And of course, you can make graphs with them. I am personally a big proponent of Python. I enjoy using it. I think it's relatively simple to learn. There are a number of other people who prefer R, right? Both are free. Both just require a bit more, there's a bigger learning curve, right? You need to spend more time to actually figure out how to load some data and graph the data. But, I think especially when we're talking about using low-cost sensors in historically underserved areas where maybe the capacity to utilize something like Python or R or some other programming language isn't there. Excel and OpenOffice and these things, they offer a lower barrier to entry. And so maybe they're the right choice to go with first, right? And then, again, I really like the comment that someone made earlier about capacity building and how we can do this thing, and maybe it's not always applied, and what that and how that creates some difficulties, right? And it's a really good thing to think about, and we have to ask ourselves, if we start saying, oh, you should use this tool because it is the absolute best and it's the only one that does everything that you need, if the learning curve is too high, then is that a barrier to entry, and does that not mean that there's uptake in using it? And it's a complex question. And I think the overall answer that I would have is use what you have, use what you're comfortable with, and there are other free options if you want to upgrade and you feel like you need to upgrade.
Thank you, Dr. Michael, for those inputs. I see Dr. Subbu is with us here. Hope you don't want to be silent anymore. Any comments, Dr. Subbu?
Sure. Can you hear me?
Yes.
Yeah. So I think that is a great presentation, and thank you for allowing us to share our best practices for this. I'll just say that, even I don't use R or Python. I use eGAR. This is a graphical / programming language that I started using 15 years ago. I've been using it ever since. But I've used Excel when needed, and so again, it comes down, like Mike said, a lot of the things can be done with Excel. If people have lots of programming languages, like I go to, a lot of our work is in Africa, in places like Rwanda and Cote d'Ivoire and Accra, and a lot of the students there who are just doing their masters, they often are starting to learn with Python, which is much better than I ever can do. So I think that's a significant advance. But still, not everybody can code, right? Or not everybody wants to, because the key is basically you want to use the sensors and use it for data, not for actually learning coding. And we are all air quality people here, so if people like Mike and others, they know coding, or people like Rana can come on and talk about hardware, and this is great, and this is their specialty. But most of us are united by our need to know more about air quality, so we want to get to the data as fast as we can. So to enable that, and I don't know if Mike mentioned this, but we are trying to make these tools available, which are Python-based executables. So Mike, correct me if I'm wrong, you don't need Python to actually run these apps, things like RShiny or whatever, or the Python-based code, and people can just input their data as CSV files, get a bunch of corrected and calibrated data on the other end, possibly with some pretty pictures. And so I think that's hopefully will be available very soon.
Yeah. That should go up on GitHub by the end of the week or so, end of next week.
Perfect. Okay, so we have a couple of more questions, but as I mentioned, I will compile everything and then send it to you for your response. And there are a couple of attendees who have asked for your slides and papers, so we will reach out to you on that as well. So again, thank you, Dr. Michael and Dr. Subbu, for helping us out to, have this expert class. Thank you again. Now, moving forward, let me invite our next expert, Mr. Ronak Satharia. He's the founder and CEO of Mumbai-based startup Respire Living Sciences, and he specializes in IoT and big data power technologies for carrying out measurements in various locations, geographical locations in the country. Over to you, Ronak.
Yeah, hi. Thanks, Pratima. I guess I don't know how much time I have. I mean, looks like I'll try to do this in about 10 minutes or maybe less. How long do you want me to do this for? Is about 10 minutes fine? Or I thought 7 o'clock it was.
Yes, but anyway, we are running late. I would want you to, take 20 minutes, 10 minutes of the presentation and the 10 minutes on demo.
Yeah. All right.
Thank you.
Cool. So yeah, I mean, basically, I'm going to speak about air quality monitoring in India. And there's, the low-cost sensors have been around since 2015 in India. Atmos is one of the devices we make. It does PM1, PM2.5, PM10. And next slide, please. I'm just going to quickly walk through some of the things. This is essentially used.
I have given you the access, keyboard access. You can change the slides at your end.
Okay, got it.
Perfect.
1 second. All right, understood. Okay, so I think I was asked to speak upon AQ sensor monitoring devices and then speak about a use case. So I'm just going to quickly talk about what does it take. The previous speaker Mike has talked about improving accuracy and essentially establishing the calibration and validity of the data. I'm going to try and touch upon what to do once the data comes, especially in the Indian context, and what does it take to kind of build an end-to-end solution at the city level. So that's something we've been doing for a while. This is just a broad, high-level understanding of where does this solution fit in. It's essentially to democratize data and technology to make it available to everyone. In the Indian context, there are about 8,000 cities. So I'm not going to get into a lot of that, but the cost factor is the significant one which is at play. Sensors themselves, there are a whole bunch of them. PM sensors, like the previous speaker explained, there are plant towers, there are other vendors. There is gas sensors, electrochemical. Once you get the data from these, you still need to transmit them, and cellular tends to be the preferred way, but there are other technologies available depending on the context. We've tried out with NB-IoT, we tried out with peer-to-peer networks, and then making the data available through time series or GIS-based APIs after applying the real-time calibrations on them. So that's typically really what the end-to-end solution looks like. The sensor itself, I think Mike has talked about it, but at the core, it really is a laser scattering sensor. If you open it up, you'll see what's inside. I mean, there is a laser firing from this bottom right, as you see, and that's essentially what this whole technology is at the core. It can get dirty. It does require cleaning from time to time. We also have a particular piece of technology called fault detection integrated into the board, which detects failure of certain components or suboptimal performance of the components, which reflects in the data also, of course. The first step, as many of the folks have talked about, is co-location with reference. You basically have a EPA grade, FEM, FRM grade monitor. You co-locate it with the low-cost sensors, and then you track. You have these graphs, so you can evaluate the inter-device performance and see how well are they with regards to each other, and that kind of gives you a good sense of the precision, though it may not give you a sense of the accuracy. But the first step is to establish precision, and that actually doesn't require a reference monitor. The precision can be done just by the sensors themselves, by putting them all with each other. And that itself has a good number of applications where you have a precise number of sensors working on the right technology, can allow you to do applications such as hotspot detection and various other analysis. The assessment done in Mumbai, I think Dr. Tripathi earlier has referred to it. We were part of that study, and the results from that have been made available. There is high precision available from these devices, and that actually allows us to solve a number of challenging problems. The accuracy can, of course, be improved over time, no question about it, and there are different calibration algorithms, different hygroscopic corrections, including humidity corrections that can be applied. But even by themselves, this technology is very, very robust and usable in its basic form. And that has been time and again proven in a number of collocated applications. The point in case being, if you see here at the top left, the airport analysis has shown that a number of different sensor manufacturers have reported reasonably consistent data. And the black line you see is from the reference. And as you see that the reference has underreported, which actually can point to the reference being off and having a substantial bias. So you can very well pick underperforming reference monitor. And that I think is something which is a concern, and specifically a concern in India, is that while we may go and collocate with a reference, somebody needs to validate the reference monitor itself. And the reference by itself is just a single reference monitor. You may be not able to catch a bias in the reference. So it would be prudent if you're doing a serious large study to have multiple reference monitors, at least 2 of them at any given site. Consistently, the R-squares provided by the devices, this is actually results from our deployment in Mumbai with the reference, and a number of locations you will see that the device has given up to 0.9, 0.8 R-squares with MAPs being around 10%. This is incredibly positive results, because this is the cost factor is about 1/20th of what the reference grade monitor gives. PM10 also has been peer reviewed and shown to have reasonably good up to 0.8 R-squares with the SMPS. This is the solution, which is, this is what really it takes to build the end-to-end PM 2.5 based monitoring solution for the country. A number of different technologies kick in. Building the monitor and validating the data is frankly about 25 to 30% of the end-to-end solution. There are a number of steps that kick in. Benchmarking, of course, is part of the initial rollout. And we've evaluated our equipment at the US Embassy. There was a blind study done by Duke, where they took monitors from a number of people. And this is a published result of 0.89 R-squares is what they found. These are all Delhi. And I think, as the previous speaker said, these results have to be put in context of the levels that are being looked at. This is the way to visualize this data, and this is really what it boils down to, that you can chase as much accuracy as you want, but ultimately you need to communicate this data. And simple visualizations of an air quality calendar, or I'm just going to show this really will actually give you a classic use case of how this data can be used by people, is to understand spatial and temporal trends. If you see, this really is the crux of the slide that I would like to talk about, is how do you use this data once you start getting it. This is actually from Subbu's one of his deployments, where a spatial and temporal deployment can help you understand the hotspots in a city, and it can tell you immediately which locations are much worse than others. And a simple graph like this, in a 2-dimensional visualization, gives us a clear indication of which locations are how much worse than the others. Temporal trends on the bottom, you'll see these are classical diurnal trends, which tell you that some hours of the day, especially 7 a.m. is, in this particular location reported 190, whereas the 3 o'clock reported 50. So you have a 4x difference just in a matter of a few hours. So there's adequate, whereas the graph on the top is for NO2 and ozone, and it clearly shows you that, you know, ozone and NO2 have a very contradicting trend. And these are some use cases that are relevant once you start getting air quality data on how are you going to build advisories, what are you going to do with the real-time data. We have these dashboards, which, you know, we get a number of requests to build the control and command centers for an integrated view of what's going on. And ultimately, you do need to provide this to the decision makers, because no matter how much data we collect, unless we don't communicate it in an integrated way, people are not going to be able to take actions on this. Some more applications, I think a number of speakers have talked about the indoor air quality. We are doing a project with one of the foremost building energy, building science institutes in India, CEPT in Ahmedabad, and they've been rolling out Atmos in a number of indoor air quality projects. This is to evaluate, you know, the HVAC systems as well as the indoor air quality and ventilation. So we've actually added CO2 and air velocity sensors to Atmos, which kind of gives you the flow rate, the air changes per hour, and the other ventilation related parameters to be closely tracked. You know, use cases of air quality monitors can have come up in various different ways, and a group in Mumbai used this to measure the efficiency of masks, and this is actually live as we speak, and this deployment is now currently being used by several hospitals to evaluate this, and it's being backed by the government too. So the solution essentially has 4 parts. It has the devices, which is about a quarter of the solution. It has APIs, which provides live data, which is another quarter. Visualizing this data on maps and in ways that people can view it, and integrating this with third-party platforms. So this really is what the whole solution is about. There are 400 plus deployments, actually more now. I mean, this is a bit outdated slide, but there are, I think, close to 600 monitors now deployed across India for Atmos. That's pretty much all I wanted to quickly talk about. If there's interest, we can quickly show some dashboards. My colleague Ritesh is online, and if Ritesh, if you want to just come on video, then you can show a few screens. I think that's pretty much all from our side, Pratima. Ritesh,
sure,
hi.
You can go ahead with the dashboard, yes.
Sure. Ritesh, would you be able to share the screen? So this is actually the live dashboard, which is used by a number of people. If you want, can just log into the MPCB portal. I'll ask my colleague to just log into. So this is something which some of the regulators here use. And this allows some of the, you can, you know, zoom in, and these are devices which are right now live in Mumbai reporting data. And some of these graphs, you know, you can see it in real time, and you can get a sense. I mean, there's still more insights and analytics which is getting built. And this is one way to view the live data. We kind of report this. You can get a view, through the table. Actually, if you click on the table, Ritesh, then this is an integrated view for somebody who's managing the network to see how much is online, how much is offline, what kind of monitors would they want to publicly share. If they don't want to share some monitors in the public domain, then they can turn it off from here. And there are a bunch of other screens, but this is kind of a quick snippet of what's available when people are running a large network. So that's, and then the chart actually, if you can just click on the chart once, I can actually give you if you pick the EF, hang on, let me tell you, if you just pick the device which is in Powai, which is actually at IIT Powai. So there is a device ending in EF91. If you pick Ritesh, I'll just ask him to, so this device is currently, and if you pick the February period when it was co-located, just pick 1st Feb to probably 1st March, which was the period that it was co-located at IIT Powai, and just pick an average of 2 hours. So this allows you to just pick Powai over here. So these are all reference sites, and it's going to just very quickly give you an idea of how the reference and if you just in the correlation select EF91 Ritesh on the correlation performance drop down, yeah. So this will give you a very quick summary of what the R squares were and things like that. So if you increase the slice time to 4 hours or 6 hours, you will see an improvement in the performance. So depending on what kind of decisions you want to take, just change the slice time to 4 if you can, just in the average time below slice time. Yeah, if you change it to 4, you'll see that. So I think the point being that ultimately here the R square has gone up to 0.75. And this is a classic example of time series data. And while you may be chasing high R squares, you can get good decision-making data sets based on how you look at your data. And really speaking, if you're going to take 2 or 3 decisions in a day, then this is pretty much kind of gives you an idea. I think Pratima, this is broadly what we wanted to show. I mean, we can quickly show the device, Ritesh, if you have it with you. If you just actually on your video just show the device how it looks, then that's pretty much it. It's a small handheld device, and there are a couple of slots at the bottom of it, which is what you kind of have to make sure that they are well maintained and well ventilated. And so data, there is data correction and all integrated into the device. There is a sensor fault detection circuit implemented inside, so it immediately will report back if any of the electronic components are malforming. And that's pretty much all that is there. It's a small enough device. There is another version of this which has air velocity, CO2 and ozone sensors integrated into this. And that's all from our end, actually. That's all, Pratima, I think, from our side.
Yeah, thanks, Ronak, and thanks, Ritesh, for having the demo session along with your slides. I'm sure many of them who don't have any idea on the glucose sensors devices, because we have got some questions on how the devices look, who are the manufacturers. So I'm sure this demo would have been really useful for them. I thank you both again. I know that we did not give you the time allocated for presenting, and really apologize for that. But I think you were able to cover everything on the device. Thank you again, Ritesh and Ronak. So here we are at the end of ICAS 2021. We completed 2 days very efficiently, and we had really good conversation on various topics and the co-benefits of climate and health, capacity building, inequality due to air pollution, and some really thought-provoking ideas that we will definitely be pursuing in the coming days and months, and definitely prepare for the next IES. First and the foremost, I would like to express my sincere gratitude for your participation and valuable contribution to making India Clean Air Summit a success. I thank all the speakers, panelists, session chairs, and participation for the active participation in all the sessions over the last 2 days. I definitely would want to thank you, our funders, MacArthur Foundation, CIF, Bloomberg, and Shakti, for providing support to CAP's team at CSTEP. Without that, it would not have been possible for CAPS to organize ICAS. And I believe that ICAS, over the years, it has initiated a shift towards improving collaboration and, building a narrative on the topics that are crucial and important to prepare our strategies towards the Clean Air Program. And we hope to maintain this momentum going forward and have multiple conversations with the various stakeholders for generating and brainstorming on the new ideas. We look forward to your contribution and feedback and support. Please do write to us if you would want to work together or have any any discussion on what needs to be done, where and how, we would be really happy to hear from you. And this will also enable CAPS to build its expertise in addressing air pollution across India and Southeast Asia. So thank you, everyone and all. Let's keep working towards clean air India. Thank you.